My name is Angelica Giacchella, and I'm a victim of serious medical negligence for approximately 21 horrendously long years. Angelica Giacchella, I'm telling the truth about the major mental health facilities that disrespected my human dignity of God within me to be respected as a human being, disrespected my human free will of choice, and wrongly misdiagnosed me with a general term, schizophrenia, which is a general term, not a specific mental health concern name, with any specific mental health concern symptoms not mentioned in the general term definition. Angelica Giacchella am a victim, a woman. I was a child, barely graduated university, a girl. I originally had a blood clot and was wrongly forced against my free will of choice, which is illegal, by psychiatrists and doctors to be put in a mental health ward so that they had a patient to make a paycheck. Keep in mind, all doctors and psychiatrists that all doctors and psychiatrists and medical staff, other ones such as nurses, practical nurses, and registered nurses, have to swear an oath to God that their paycheck is going to be made to help human health and brain mental health, to care for the well being of their patients. A doctor or psychiatrist, or a nursing staff or registered nurse, and other medical staff, pharmacists, physiologists, all including board members that hire the staff in medical and mental health facilities, the trustees, the CPSO, for example, one of the colleges that gives the license to these medical professionals, doctors, and their psychiatrists. They swore an oath to God that their paycheck is only given to them if they choose to help human health, to do what is morally right, to help a human being, to save their life, to promote proper mental and physical health, to assess their health properly, and to hire staff and deal with other staff that are there to and find staff to help these patients to maintain their proper physical and mental health at all times. If a doctor or psychiatrist, nursing staff, a board member, most of them are medical doctors, and the leaders of the owners of medical facilities such as hospitals and mental wards disrespect this in any way in their thought processes, then they cannot make their paycheck. It is recorded in every human thought, mind, physicality, and soul. If a human morally chooses to do wrong to harm another human life, this has to deal with medically negligent doctors and psychiatrists. that swore an oath to God to make their paycheck would only be given to them, and doctors' medical license, doctors of psychiatry, their license to work, and other registered nurses and practical nurses and nurses, physiologists, all other medical staff, pharmacists, physiologists, surgeons, the boards of the head departments, clinical scientists, researchers especially, have to morally do the right thing to help. What they trained to do is to help, and they chose to help patients. Promote proper physical and mental health and the well-being in general of a human being, which has a life, a human dignity within them, of God to be respected as they are to be valued and respected in every way as a human being, to have proper mental and physical health at all times, to be respected, their free will of choice of the patient, to have proper medical and psychiatric care, to be treated fairly rather as a human being, to be respected, a human with emotions, a soul, to be spoken to fairly, to be listened to have the doctor or psychiatrist and other medical staff be attentive rather and listen to the needs of the patient, to assess their medical and mental health properly at all times, and or to refer them to another specialist when necessary, proper timing to help the health, to promote the health of a human being, mental health and physical health. When a doctor, psychiatrist, or a registered nurse or other staff member or a board member, and the CPSO is one example, but other countries have different names for the colleges that give the licenses and or hire the medical doctors and psychiatrists. Then there's the CNO in Canada, the College of Nurses of Ontario is one example, but other provinces and countries have their own that hire the registered nurses that deal with them. The nurses, the practical nurses, the other colleges govern hiring and are required and sworn oath to God to hire employees that care for human health, that will respect human mental and physical health, assess it properly, and treat every human with respect. Respect their free will of choice, to have proper medical care, to be treated fairly, to be diagnosed properly if they have a mental or physical health concern in proper timing, to be cared for as a human being, to be respected emotionally, a human with a soul, a human being to be respected in all ways, ethically, morally, treated properly, and their lives and health never endangered by any of these medical staff that these colleges hire. But Angelica Gicella, I'm a victim of horrendous medical negligence. Angelica was a child and was poor but saved money and worked for myself to pay through university to do life science and get a job, and chose to do medical lab research. And I'm educated basically what the doctors know, and or as well a morally right human in religious studies. Was a healthy figure skater, learned that as a child, played the piano. It all took learning effort as a child for years, and then I lost it all because the colleges of physicians and surgeons of Ontario, the College of Nurses of Ontario, the other head colleges, they employed employees, gave paychecks to medically negligent doctors and psychiatrists. nursing staff, registered nurses, and practical nurses. Angelica was wronged illegally and a child. I barely graduated my last year of the university, and anything that I worked hard as a child and paid off the many thousand for university myself and poor, I lost my driver's license as well because of medically negligent staff. Chose me to put me in a mental health ward, not the medical one. Wrongly assessed my mental and physical health. Wrongly stated and put me on a file under schizophrenia, which is a general term that I choose to get rid of from the world entirely. It is not a specific mental health concern name in any way. It does not state a specific mental health or brain problem. It does not state any symptoms specific that a human has of any mental health condition or concern. This is a general term. Myself and hundreds of people I've seen over 21 horrendously long years were misdiagnosed illegally, unethically, and morally wrong done by these medical staff, doctors, psychiatrists, and other specialists, medical specialists, board members of the main hospitals, medical, and mental health facilities in Toronto. So they had a patient to see once every 2 weeks, write a prescription for dangerous antipsychotics. I didn't need in my situation at all because I didn't have a mental health concern at all. I actually had a blood clot, which is a medical concern, and they endangered my life more. And they misassessed my health. They swore an oath to God. The College of Physicians and Surgeons of Ontario did nothing to monitor these psychiatrists and doctors. The College of Nurses of Ontario that have to give the license to the doctors, and the other one, the College of Physicians and Surgeons of Ontario, and then separately the College of Nurses of Ontario. They govern hiring the nursing staff, the registered nurses, and I dealt with, was wrongly given against my free will of choice, approximately 50 medically negligent doctors, psychiatrists, other specialists, and I dealt with illegally against my human free will of choice. I was an intelligent human. I chose to deal with intelligent medical staff that cared for my health and intelligent psychiatrists. But they disrespected these, and I dealt with over 50 medically negligent medical doctors, psychiatrists, specialists, and over 50 to 100 medically negligent nurses, registered nurses, especially practical nurses, in Toronto, in Canada, wrongly even given to me against my human free will of choice, which is illegal, disrespected my human rights, patient rights, my God-given free will of choice to be dealt with proper caring medical doctors rather and psychiatrists, caring nurses, caring registered staff of registered nurses, practical nurses, specialists, GPs. Angelica had the right to have assessed my proper health of my brain and physicality, but this was disrespected and is not allowable. And unfortunately, these doctors, medical doctors, psychiatrists, the specialists, GPs. These doctors were employed at Camh, the Center for Addiction and Mental Health in Toronto. This facility has hundreds of employees illegally working there, smiling, never look a patient in the eye because they know they're doing morally wrong, to children, old people, and people of all ages. Over 50 medical doctors, psychiatrists, board members, and 50 to 100 nurses, registered nurses, and practical nurses, and other staff. Wrongly misdiagnosed myself, a girl then, and for 21 years approximately went along every doctor and psychiatrist and the nursing staff and board members, certain ones, and wrongly misdiagnosed me and others I've seen is true with schizophrenia. Even stated other humans misdiagnosed, which they don't even have, with catatonic. None of those humans had schizophrenia or were catatonic. My life and the lives of other patients, which became poor like myself, I lost my university degree and I was child poor, work hard to pay off. I couldn't play piano for years. I couldn't go figure skating, what I learned as a child to use through my life to have a job, to make a family, to have money to live saved up over the years. I lost my youth after from 20 years old to approximately 40 years old, wrongly misdiagnosed with a general term, schizophrenia, and or catatonic, which I didn't have at all. I didn't have any mental health symptoms at all, and was put there illegally. So this medically negligent staff had a patient. They essentially came to the office, spoke with me, disrespected what I told them to have another physician's opinion, psychiatrist's opinion. Half of them were rude, and I'm a lady. And they misdiagnosed me continuously, and over time, they referred to another medically negligent staff members if they left, and forced me, against freedom of choice, and put other humans wrongly made substitute decision makers that didn't act in my best interest illegally, and put them to sign for treatment, which is treatment is not treatment what they gave me. Treatment is a term used to help human health, mental health, and physical health. But what they did was illegal. They damaged my brain. They damaged my memory. They damaged my thinking cognitive abilities. With these antipsychotics that they wrongly prescribed, and I fought for my own life but had no money for a medical negligence lawyer to get myself out of that situation. And they wrongly prescribed me illegally and knew that I didn't have any mental health concern at all, but I had a medical one of a blood clot and they're in blood thinners at the time, which further was a reason why they couldn't wrongly misdiagnose me with any mental health concern I didn't have and wrongly prescribe dangerous antipsychotics that damage the brain in many ways, memory, thinking abilities, and physical health of me, and I'm a lady. I lost 20 years and couldn't have children because of dangerous side effects. I was wrongly prescribed clozapine, high dosages, and I was a lady, didn't need it all. I was wrongly prescribed olanzapine and forced to take as well. over time that I didn't need. I was wrongly prescribed risperidone, which I didn't need. Over time, I was wrongly prescribed Abilify or aripiprazole, which severely damages human cognitive thinking abilities and other parts of the brain, which no human should live through. All of these dangerous antipsychotics, and I was wrongly prescribed polyperidone. These are really seriously harmful to human brain and physical health in many, many ways. These were given to me or illegally given to me by doctors, psychiatrists, as stated, and went along over the years. Over 50 medically negligent staff in Camh, the Center for Addiction and Mental Health, in the Camh, the main buildings, and in Camh Emergency, and also in Mount Sinai Hospital. These are the main, in downtown Toronto, in Ontario, Canada, the main hospitals and their mental health facilities and their psychiatric wards. Most of them have high-level studied doctors, medical doctors, psychiatrists, and a lot of other staff going along with them misdiagnosing patients. Half of them are rude, most of them, all of them, when they know is morally doing wrong, never, as I stated, look a human patient in the eye when they're wrongly misdiagnosing them with schizophrenia, a general term. It is not a real mental health concern name. There are a lot of people that are not educated and don't know about these as patients and suffer needlessly and did over 10 years, some 20 years, still there, some humans, illegally, some against free will of human choice, misinformed by these doctors, psychiatrists, wrongly pushing pills, dangerous antipsychotics, some of injectable right into the human, cause serious side effects of brain memory, thinking damage over sedation, make human have too many high visceral fat levels, can a human might become diabetic, the sugar levels wrongly affected, the human immune system is harmed, a human has lowered life expectancy by 10 to 15 years. These are not a cure in any way. These are damaging and very dangerous to humans. And are these doctors and psychiatrists, and I'm an intelligent human studied life sciences and medical studies, what the doctors know. Fought for my life telling these, but other humans are not educated, and some don't know English, were wrongly put there in these mental health wards in Camh, and some still there, from some for 10 years, some over 20 years, illegally put there, and doctors still working there. That I filed a complaint, and if I had a lawyer, would sue for punitive damages and easily win. They illegally harmed human health, brain and mental health, and a lot of them are doing and working with the University of Toronto, are affiliated with the University of Toronto, one of the main well-known universities in the world, in Canada. They are, most of them, associate professors at U of T, professors, lecturers. These medically negligent medical doctors, psychiatrists, the other nursing staff, clinical scientists, one of the well-known, they're all researchers. They have their own published articles in the journals, in PubMed, in the well-known medical and psychiatric journals, which most of them I read, and I'm human educated in medical matters, which their most journals are written based on illegal human torture. They medically misdiagnosed a human patient, a live human, to do research, to push pills, and wrongly to make a paycheck. And while they wrongly misdiagnosed, look away from patients, sign the prescription their own name for these illegal, dangerous antipsychotics. Mine, the ones I had, I was prescribed wrongly, and I'm a lady, couldn't handle in any way and didn't need it all. And the other ECT, electroconvulsive therapy, which I choose gone from the world. It does not help anyone. They wrongly prescribed it to children, old people, which clearly can't handle and do not need it all. The other medical staff working in those departments are still working there. Having to do with Camh, there's a brain Temerty center. It is a new facility. The Temerty Center and the Temerty rather is the name of this company. Is also dealing with University of Toronto. Is gonna have one of the new medical buildings. They are there and have employees working there, medically negligent, doctors, psychiatrists, most of them affiliated with the U of T, teaching for years, making another paycheck. Illegally did research on humans, most against human free will of choice, signed papers and put them on forms as well to mental health wards in disgusting, inhumane buildings with not enough proper circulated air, with not enough nutritious food, with no given any supplementation if needed. To humans, and especially myself, I fought for this to get even a supplement meal replacement. A human has to have, while given these dangerous antipsychotics to help them, vitamin B complex, mainly omega 3s, to help the heart and brain. Vitamin D help the immune system and overall brain health, help the mood, and mainly vitamin C and antioxidants. Vitamin C reduces oxidative stress on the physicality. And every human, when given these dangerous antipsychotics, needs these main supplements when they don't have enough from food. And these mental health wards have hundreds of millions of dollars. It is true, to afford food for these patients, myself included, did not provide this. Myself for 20 years, other humans I know of, some for 10 years, some even as 20 years as well or longer, were in these mental health wards with nothing to do there. They barely hire any social workers to help human patients there. There's a kind one or two nutrition staff that care enough to help a patient. The rest are medically negligent doctors, psychiatrists. They come to the patient, they tell them, ask a standard question, how's your mood? They wrongly write a prescription and then say, in 2 weeks, I'm going to see you for the next appointment. That's all they do and make their paycheck. They don't care for human life. They do not respect the human dignity of God within a human to be respected, valued as a human being with a life, a human that has a family, a human being, to be respected, their brain and physical health. They did not respect human free will of choice to choose, when they choose, most patients telling them, I don't need these high doses of antipsychotics. I don't need ECT. Tell me what my mental health concern is that you are trying to misdiagnose me with. Tell me why you're trying to prescribe me these dangerous antipsychotics I don't need. They never state this. That's why most people, but some are not educated in these matters and don't know the patients need another second opinion from a properly trained, caring medical doctor or psychiatrist, not one referred to another one that works also at Camh or Mount Sinai that is medically negligent as well. And pushing pills, doing illegal human research, which is unethical on humans, a lot against human freedom of choice, which is human torture, illegal, is a human. Those humans need their paychecks, cannot make their paychecks. These doctors, medically negligent, medically incompetent. These psychiatrists, medically incompetent, know what they're doing morally to the right, studied the 4 years, studied the medical school, psychiatry school is long studies, paid the money, and chosen are harming human health. Most of them, me, for 20 years, other humans, some over 10 years, all of those humans still in Camh. The humans are essentially brain damaged, have too much fat, gain weight, have other side effects depending on the antipsychotics given to them, most overdosed, are knocked out cold over sedated for 12 hours, which is not beneficial to anyone's health. They get up, there's not enough nutritious food to eat. They already given their doses, and then left by the staff and have nothing to do in mental wards. And it's COVID times, they can't go outside unless maybe on a pass with other staff, maybe once or twice. But if it's serious COVID, they have to stay indoors and have nothing to do. There's no funding enough for any the more social workers to provide to find them. They're all poor. They have one jacket and live with that in Canada where I am and myself for over years. No money to buy a new jacket, even shoes. They have no money, obviously, for anything else. They are given ODSP, which is maybe $200 to $1,000 to last for a whole month on disability in Ontario. This is not enough for a human to eat a few burgers for a week, and a human has to live off of it. These humans in mental health wards like these, and it's Camh, and there's some long-term care facilities there. There's other departments. The humans there, some have been there and have been there for over 10 to 20 years. Some don't know about this still because the doctors don't inform them and didn't tell them they're being medically negligent towards them. Humans trust doctors. Humans trust psychiatrists, nursing staff, especially those not educated in medical matters, because they believe that the doctors swear oaths and psychiatrists register nurses to help human health. But they don't know, a lot of them, and that's why I'm mentioning this in this video and other ones I made. Please spread to 100 million people. Would love to hear this and avoid being put in this situation of being wronged by a medically negligent doctor or psychiatrist. There's many people that I've seen and still walking around misdiagnosed downtown, especially with schizophrenia. They don't have it all. They don't even need it. They were wrongly prescribed this illegally, and most don't even know that this medically negligent doctor misdiagnosed them. There's staff not monitoring these at Camh, and the patients walking outside, which is dangerous to the health. Smoking obviously cannot, well, especially on clozapine or other dangerous antipsychotics like olanzapine, risperidone, Abilify especially, polyperidone. That's the main ones I know of, and most were given. There's other ones worse, I don't want to say. These severely damage the human brain, thinking abilities. A human is almost, they can't think at all, is severe brain damage, is beyond words. No human should live through and overdose with this. Some injected into the muscles and have bilateral tremors, shaking, side effects. This is not beneficial to any human or mental or physical health. These medically negligent psychiatrists and doctors I'm telling everyone to please watch this video on medical staff and board members, trustees of Camh Emergency, Mount Sinai Hospital in Toronto, Ontario, Canada. Other hospitals in Toronto and other in the world, all of them. I've seen this. I've heard it all. I'm an intelligent human. I've lived through 20 years and lost of life suffering because of medically negligent staff and are still unfortunately working there. After I filed only what I can do when I can afford a medical negligence lawyer, which is very expensive, and human on disability doesn't have money for years to live. I couldn't save money off this disability money as well. I am telling this so that the other potential patients know to avoid any antipsychotics at all cost. So you don't have harmed brain, memory, thinking ability, physical health that you don't need. You cannot have children while on this. There's dangerous side effects. Require frequent blood testing to be monitored. Leaves human without blood enough and weak. Damage the heart. Human can exercise. Human can barely think. Accomplish basically nothing. Can't even do a job. Be in place mental ward maybe. And accomplish nothing there. Can't go outside, especially during COVID times to prevent the spread. No human should live through. Can't even go out for air most times. And the food there is disgusting. It is not nutritious in any way. Patients basically given 1 or 2 box small of milk, and the rest maybe sometimes it tastes good. Some eggs in morning, maybe one lunch. The rest given some stale muffin, some kind of food. The chicken that can't even chew is disgusting. Tastes like cardboard with no nutrients. And a human has to live off that. When given dangerous antipsychotics, and I help some humans, but I do more. But I need others to help me. This is humans there need the supplementation. Is beyond wrong that these humans not even referred by these medical doctors, psychiatrists, to given this B complex. They help the many parts of the brain what the patient needs, when mainly from food, but if they don't get enough, to supplement a B complex. Helps the brain, physical and metabolism, the physicality as well in many ways. Vitamin D, as I stated, omega-3 fatty acids, and vitamin C mainly, antioxidants, reduce the oxidative stress on the physicality, clean it out, help the immune system while on these dangerous antipsychotics. Low-fat meals. These humans are not told to avoid caffeine. Every human there almost goes outside for coffee. Patients not monitored. And the doctors, psychiatrists working there don't even inform mostly half of them. And me never told. I found this information myself, but I'm a human with a university degree. Others, a lot of people are old, too young, don't know about this, and are not made aware. This, when a doctor first assesses the health of the patient in Camh Emergency, the other Mount Sinai Hospital in Toronto that I went to, others probably as well. And don't prescribe any supplementation. A human could easily, and I know this, and all proper trained medical staff, medical doctors, psychiatrists that do know this care, know that a human health, mental health is better off if a human is living safe in a home alone. I mean, safe away from a mental health facility where they don't have to see other humans suffering on dangerous antipsychotics with side effects no human wants to see. And for a human to live in a house or a place that makes them happy, where they have their own things, where they not job, enough money to live, may have their own family, a A child has kids as many as they choose to be healthy, to refer them first for to make sure their diet is proper, that they exercise, for them to sleep the 8 hours they need to be healthy, and to inform them with cognitive behavioral therapy rather is more important than misdiagnosing with schizophrenia, which is a general term, which is not a real mental health condition concern at all. It doesn't state any real symptoms, as I stated, and I choose this got rid of from the world. And it's still unfortunately there in 100 million videos, and doctors and psychiatrists have their names there, and people misinformed. And they don't even state the real medical mental health concern of the brain, what is affected, but of the patient, specifically what needs to be treated. This is online. These are 100 million videos. These are 100 million medically negligent staff, psychiatrists, nurses, pharmacists, especially that go along with the clozapine, is a big market in the pharmaceutical companies. This is mostly illegally given to patients. Angelica Chu's is gone from the world, clozapine, entirely. It has no benefits rather to human mental or physical health. It damages a human health, brain, mind, and physicality. A human disrespects the human health and life so many ways, and it lowers the human life expectancy, if taken in the long run, for a human to live less for approximately 10 to 15 years. Will die sooner. It is not a cure. It is very dangerous to human health and negatively affects human health in so many ways. Endangers the human. It damages the human immune system, the brain, in many ways, oversedates human. Is not proper to human health in any way. Creates too much visceral fat. The human sugar levels go up and down. It is not beneficial to anyone's health in any way ever. If taken too long, it damages the human brain more than it does any good, and human physical health fails. Angelica Choose is gone from the market. I lived through it for almost 20 years on clozapine, and I was a woman, didn't need it all, and couldn't have children because of the side effects that harm my brain and physical health in so many ways, and frequent blood testing needed to monitor because of the potential, the side effects. And Angelica left with blood enough veins for almost 20 years with a damaged brain, not enough nutrients. Fought for my life there with these medically negligent staff doctors, some rude, saying, "No, you need treatment." I said, "For what?" "Schizophrenia." I said, "What is schizophrenia?" It's a general term. Tell me what what you think my brain or mental health condition I have is that needs clozapine for you to prescribe to me, or olanzapine, or risperidone, or Abilify. That damages my brain. That damages my memory, my thinking ability, my life. I'm a woman. I have a right to have children, choose to be happy. Tell me specifically what mental health concern you think I have. And the symptoms that I obviously have. Tell me which symptoms you think that I actually have before you prescribe this, or ECT. And then they turn to the side and they look away and say, because they know they're morally doing wrong to make a paycheck and have a patient, and say, "This is your treatment, clozapine." I said, "You didn't tell me what you're giving me clozapine for. I'm not gonna damage my health taking clozapine when I don't need it. It damages my brain and health more if I don't have a mental health concern to treat." They said, "You need treatment." Illegally. It's not a treatment if it's given illegally, it's bodily harm against freedom of choice and then enforced to give to human to take. Illegally, unethical what they're doing, disrespect human rights, freedom of choice, if a given human doesn't choose, accept this, and doesn't need at all, and cause bodily harm to a human brain, physical health, disrespect a woman's life, can have children and have side effects of this. They smile rudely and look away when they knew morally wrong and took away a driver's license because when on antipsychotics, a human cannot drive, have impaired memory or thought process or damaged health. And I lost all university, everything, because they wanted to make a paycheck. And had a patient me and 100 there's 100 over other people there for years. Some still there, unfortunately. Cannot afford medical negligence lawyers. That's the only lawyers type of lawyers that require that are not covered by financial aid. These are the lawyers that should be first covered by financial aid for people that are wrongly misdiagnosed as well and are disabled, brain damage because a doctor medically negligently made a paycheck $1 million to have a patient and harmed the human brain, wrongly prescribing dangerous antipsychotics or ECT brain procedure where a human is fasting for a number of hours and then injected have a harmful, painful venipuncture damages and danger the life of the vein is damaged, injected with a general anesthesia, no human should live through, knocked out cold, and then have two electrical wires, electrodes taped to the side of the head, and a pass electrical current through the brain, causing a seizure. No human wants a seizure. No human lives through. I lived through over 10 times a year illegally. This is human torture. Torture is defined as bodily harm against human free will of choice. This is illegal, is morally wrong under God, and is a human has to these doctors and psychiatrists that wrongly prescribe and enforced a human need to go against free will of choice to these procedures, even though I was weak overdrawn and didn't need it all. This thing I'm doing fantastic over time. How's your mood? I said I'm doing great, great. Then I said, what are you giving me, trying to force me to take ECT for? They said, oh, you have schizophrenia. You're catatonic. I said, a human that is catatonic cannot go through ECT, endangers the brain and human physical health. I am not catatonic. I obviously am thinking clearly and healthy. I don't need to go through ECT. I don't have schizophrenia because it's a general term. And then they wrongly signed the paper. Okay, I'm gonna put you in consult and put human substitute decision makers that were not intelligent and educated and didn't act in human patient my best interest, unfortunately, but cannot do it because it's illegal. But it did, and other humans in the situation as well. They find humans to make decisions not educated, so they make the decision, the substitute decision maker, the SDMs, a decision that so they make the treatment to accept for the patient that the patient would make their own decision proper for their health. But a lot of them don't make the proper decision, are not educated, and these psychiatrists medically negligent, doctors as well. They know this and put these not intelligent substitute decision makers there, not educated, that make not even by on purpose, but that aren't educated, not informed even by the staff, medical staff, to make the proper decision for the patients to accept the treatment or not, the ECT, if it's treatment or is illegal torture. If a human doesn't need the ECT, obviously not. I choose get rid of this from the world. It should be done already for years. It doesn't help anyone. And the buildings themselves, no human should live through. This is true. I was put an intelligent human. Didn't need at all. I was wrongly put on forms by medically negligent doctors and psychiatrists and many, many staff over the years. Nurses, registered nurses, practical nurses went along with these misdiagnoses. I told and I tell every patient if I heard, and please everyone share this to the world. Make sure you state your own truth when you believe what you think is true on any form. Tell them to write in medical records. Make sure they write it down. Clearly state, put their name written. Don't make sure they don't sign squiggly line to weasel their way out of it. Nurses, practical nurses, registered nurse, medical doctors, psychiatrists, so you have proof stating this. Get a phone recording when you have meetings with doctors and you think they're trying to force you to take illegal antipsychotics or ECT. They're trying to misdiagnose you if you have the capability, and still that's why Angelica tell you to all humans, patients spread this in the world, do not go to mental health facilities to get your mental health assessed in emergency room in Camh, the Camh, any other building, Mount Sinai Hospital, emergency wards, unless emergency, but be careful then. There are medically negligent staff, doctors, psychiatrists smiling. Some even look like they're helping you, but they look away when they misdiagnose some patients. They wrongly sign forms so humans even have to stay to some 3 days to medically or mentally be assessed to see if they have a mental or medical concern, which is beyond wrong. They should treat this as right away and have to do. But I was a victim of this as well at Camh emergency more than a time a year over the years. These medically negligent doctors, psychiatrists wrongly put humans on forms so they and the other staff, there's hundreds who go along with this. Many different job titles have a job for a patient to walk them to rooms, nurses. They don't treat the nurse. Some of them one or two care. The rest are on vacation for life, planning vacation on the phone all the time. They're talking on the phone, cell phone, planning the children, talking what they're gonna do for dinner, for lunch, while the human begging for food. The patient put there, and I'm an intelligent human. I was there illegally. The put even was assessed and right to let go. I had a medical different concern, and they did it wrongly assessed, mistreated me, were rude. Certain doctors, psychiatrists, the other ones went along with it. They obviously, I'm a woman, didn't even have to be there, had to right to be let go. And they disrespect this, my human rights, my human freedom of choice. And this wrongly admitted me for 72 hours for assessment, medical mental assessment, to sit there and then had to wait and push the issue and stay telling them I don't have to be there, and kept there so they have a patient to check in the room once in a while for 3 days and nights. Well, it's supposed to be assessed right away. I had a medical concern. He dealt with right away and released. And they do this so they have patients and have a paycheck. And the humans begging for food there, Camh emergency, and the buildings there, the other wards there, psychiatric mental wards for sure, long-term care facilities, certain ones, there's many buildings. They have some been there for years, some old ones torn down, but the new ones have new names, some of them. These doctors still work there. I even filed a complaint. Intelligent human wronged illegally for beyond 2 decades, loss of life, suffering, didn't have to be at all. Intelligent human and a woman couldn't have kids for 20 years due to side effects I didn't even need. They harm health, the brain, no human even lived through it itself. A human educate medical matters, but seeing people crying there that don't even have to be there. They're begging on the street for food when they're not given enough supplements and nutritious food there for 20 years. And these facilities, even open new buildings, have empty mental health wards with no patient, and the old ones keeping the people in the old buildings with the stale air, with not enough food for over 20 years. The new buildings there could easily put these people and have clean air, hire some staff that actually care for human health and life, and do proper jobs. All the nursing staff and registered nurse except one or two. There's a 50 to 100 I dealt with, registered nurses, practical nurses, other nurses in Camh, the buildings there, Camh emergency, the wards, mental health wards, the women one, the other general ones. Other years I wasn't even put in a ward where there's only women, or some humans with a not really injected with too much overdose medication. Some humans with their drug rehab uh, part of programs and things that a woman doesn't want to see, and they should respect human health to put a woman in a different ward could easily do more quiet so I don't hear this. Other patients, I understand, have been wrong and they have side effects, but I still, as a woman, do not want to see here. No human does, not even a man. A man, even other humans injected and see them with these side effects that they don't even need and overdosed. Bilateral tremor, shaking, nerve damage, brain memory damage, yelling things are damaged, telling patients, begging for food to doctors, telling them true, but they can't. They only have to. And then the doctor's calling security almost every second, code white. Code white is irate patient. There's a staff there, and a human was there, and a woman in Camh, and here it is almost every 5 seconds. Code white. Over 100 patients misdiagnosed more for years there. And the patients have rights. They are humans, have lives. Most tell the truth. But if they start yelling, telling the doctor, they call code white. The doctor walks away and calls security. Two security members, men, big muscled men, come running and they tell the patient to calm down. Patients have rights. It's the doctors that are doing wrong. The medically negligent doctors, the psychiatrists. And a woman would tell them off to tell the truth, but I know intelligent what I can or cannot say. I don't want security coming for no reason. I'm a lady, but I have rights to tell the truth to the doctor. You are illegally writing prescriptions. You're going to harm my health. I don't choose to deal with this. I told over years I choose another medical opinion. Then they gave me another medically negligent psychiatrist that they know and they smile and chat with all the time. And I said another one. They said I just referred you to another one and rude. And these ones are still, unfortunately, I filed a complaint. And I talked to the staff, which are morally obligated, and are saying, oh no, this is beyond wrong. What happened to you? Crying. A woman, oh, a medical negligence. Sorry, this happened to you. Need to get investigators to hire this, to look into a patient file mine that has a million pages that takes a few seconds at office to, is there true? The few pages, a few minutes to look at my real patient records, to call the doctor, ask what happened, look at his records, and to figure out if he was medically negligent, if he prescribed, and obviously there is true proof that he wrongly endangered my life against free choice many ways. The doctor psychiatrist didn't maintain what they chose, swore their oath to God to help human health, and the psychiatrists, nurses, staff, all of them look into this. The College Physicians and Surgeons of Ontario, when I'm in Ontario, but other countries have different ones that give the license to the doctor psychiatrists, and separately the College of Nurses of Ontario that deal with the nurses, registered nurses, practical nurses. The other colleges deal with the physiologists, the pharmacists, medical secretaries. There's 100 million of this staff, and I dealt with over 150 medically negligent head. These are the head department heads too, medical staff, doctors, GPs, psychiatrists, well known, have actually many jobs. Most clinical scientists, researchers, head ones, most department heads in Camh, the Center for Addiction and Mental Health in Toronto, Camh Emergency, other ward buildings there that have under different names but associated with Camh, some younger human wards, women's wards, mental health wards, the other ones in Mount Sinai Hospital. These buildings are not well kept. Even the new ones, they are clean to start with, but they don't have any, mostly there's one or two caring staff, but the main medical doctors and psychiatrists that these colleges employed that are governing to see and are not monitoring these medical doctors, psychiatrists, and even after I filed a complaint, and it took almost a year in following up saying, did you start the investigation? You said you'd give me an investigator. It's an urgent matter. I would sue medically and it went multi-million-dollar lawsuit mine for 20 years, but I don't have money for $30,000 for for court fees and medical negligence lawyers. A human is unfortunate in Canada that financial aid doesn't cover. This and human has to live when a doctor screwed up a human life when they made $1 million, went on vacation and planned vacation for years, and a real true rather $1 million vehicles are still parked there outside Camh Emergency, Mount Sinai Hospital. They have houses that are multi-million-dollar houses. They are all affiliated, these doctors, psychiatrists, and other nursing staff, with the University of Toronto and other head universities. They are head researchers, clinical scientists. They have medical journals, as I stated, psychiatric ones published in well-known medical journals, psychiatric journals. PubMed online, easily accessible. And unfortunately, most of these done on illegal human research illegally on humans, rather. And a lot of them, these medically negligent doctors, psychiatrists, I human understand there's humans of different nationalities, all treated with respect, are to be. But these doctors most don't know English. They have a different background and different language, and I honestly don't know how they got through to Canada to practice medicine or psychiatry. In this country, the way I know medical training and human to be assessed needs to be a Canadian citizen. These staff, I don't know how they got employed. They don't honestly, I don't know how they even are employed there. They are not intelligent in any way. Anyone, even myself, I'm not a medical doctor, but I studied. The Life Science University dealt with other lecturers, professors. I chose to do medical lab research for years, worked at other hospitals, assistant, medical lab assistant, other jobs. I know that the medical staff are to be intelligent, the medical ones that actually care for humans, that show interest and do anything when they use their knowledge they learned in medical school or in a school studying for to be a doctor of psychiatry or a nurse, registered nurse, practical nurse is a very hard studies. These are mostly centered on human care of health and physical health. And then when they get this job, I don't know who hires them, assess them, is obviously the CPSO colleges, these head colleges of physicians and surgeons of Ontario, one in Ontario, the nursing one, CNO, other countries, other provinces have different ones that give the doctors, psychiatrists their license, the jobs, are not hiring proper staff. They swear an oath to God to maintain proper health of the patients, respect their human dignity, their rights, to be morally right with these people, to respect human freedom of choice, to respect human of all races, to treat human with dignity, value they have of God within every human, to be respected as a human with a life, a soul, knowing, considering other humans, how they affect their lives and others. And they're not doing. And they're making a paycheck, and clearly any human patient has been going on for years. I filed the complaints, other humans clearly have. There are complaints and online, some, of other patients of certain physicians that are still working there and have over 4 to 5 main high-level jobs paid in Camh, the Center for Addiction and Mental Health, and in Camh Emergency. All the wards and other buildings, there are many. There's some new ones, not all. These are multi-million-dollar facilities. There's the new ones, as I stated, only a few people in them, but could easily move the other patient old building and put them there in care, but are not. And these colleges that have the license given to these doctors, psychiatrists, they give an oath and they swear they're morally obligated under God as well. No one gets away with doing anything immoral, morally wrong, unethical. What is wrong under God to harm human life or health, to hire an employee such as a medical doctor, psychiatrist, a nurse or them, and not to follow up to see if they're to make sure they're doing their job, and if they're not, to fire them. immediately so they do not harm another human life. If they already did, to find out immediately and put them in prison. Take away their medical license, take away their doctor's psychiatry license, take away everything needed, reprimand them, put them to remedial studies if needed as well. Make sure they're taken in handcuffs by police officers to the prison immediately, not a second to wait. I filed a complaint about many staff that harmed my life, some for over 20 years. They're still illegally working there, and potentially, and some other patients I know wronged are still there and wrongly given these dangerous antipsychotics, prescribing, putting their name, signing to it, looking away when they know morally wrong they're doing to sign wrong prescriptions they don't need. As I stated, million people, patients there, maybe hundreds rather, are mostly entered under schizophrenia, which is not a real mental health concern. Name is a general term. Humans are not treated for a specific mental health concern and given clozapine or clozaril, olanzapine, risperidone, Abilify, which I tell everyone to avoid, especially everyone in the world, and ECT, electroconvulsive therapy. I don't even know why it's still called ECT. Electroconvulsive therapy is not therapy, it is human torture, when especially against feels bodily harm, don't choose, is illegal, is never justified by God. And is human sense if prescribed is wrong, a doctor, psychiatrist, is no one escapes, no one. It is judged by God, sensed in every human. They are going to go to hell. And morally wrong under Jesus exists, or human religious or not, are all judged on earth and have to morally right respect the health and dignity, freedom of choice of humans, other humans' lives. These colleges of physicians of surgeons of Ontario I'm dealing with, and College of Nurses of Ontario. And then I filed complaints to the facilities as well, the Camh Emergency, these Mount Sinai Hospital, and they all state, "Oh, we'll look into this." "Oh, I'm sorry," they're almost crying. "Oh, we're gonna look into this. I'm sorry this happened to you. They're medically negligent toward you." But then it takes him and have to follow up, push the issue. Say, "Did you follow up? I need to know this right away. I can't sue them, but I don't want these humans, doctors, to get away and potentially harm others. My brain was electrocuted. I have no children side effects because of it. Rather, I have side effects that prevented me from having children. My brain is damaged. I can't work. I had a university degree. I lost it because of brain damage, because of medical staff, medically negligent, pushed dangerous antipsychotics. They illegally prescribed and forced me to take ECT, and I'm a woman. If I didn't go, they put me on forms. Then they called the security there in the building or at home to call police to escort me there to the procedure because the doctor put on the form. I have no way, and I didn't have a medical lawyer. I cannot get my way out of it because I'm poor. I cannot afford. If I would, I'd pay the money. These have to be the ODSP disability is nothing. Is a few dollars. No human can save. And then those patients have ODSP given and still begging for food. And Camh, where there's a multi-million-dollar facility, obviously, and I filed complaints there, and they said, "Oh, we looked into this. We're helping you." And other humans I spoke to there, and they're still begging outside on the street for food. And there's not many people walking around there handing food out. Some give out this no, there's a mental health place. People are brain damaged. They put out some carts with food. Sometime they go there. But these humans are in these multi-million-dollar. These are and the new buildings cost hundreds of millions of dollars. They made the new emergency above Camh Emergency, rather, the building. This is all new and other buildings that cost so much money, as I stated. They're empty rooms, really clean, could easily put the other patients there and give them food, pay money for food. Humans already inpatient and some illegally, right, to have food that they choose is taste good to eat, to be given the supplements, to give them the vitamin B complex, the omega 3s, the vitamin C, vitamin D, and the main one, zinc, or anything that helps the brain and the physical health. That's all they need. They don't need these antipsychotics, ECT, but are wrongly given them, and no supplements, no food given nutritious at all. There's one meal that tastes good, and I was for 20 years. Some place in far to stay even outpatient. No human wants to stay there. Other humans agree, but not many people know to file complaints. They're obviously too poor to get medical negligent lawyers, and these doctors get away. And the psychiatrists, and they're still working there. And after following up, and this in with these the colleges, the College of Physicians and Surgeons of Ontario, the College of Nurses of Ontario, these colleges, they hire these and know they're crying when they hear my story, and it's beyond wrong. Happened to me, a woman is illegal. This always a serious matter, but it's almost a year. Many months, second go week, I said, did you call these doctors? They let me know, follow up. I had to follow up myself. They said that they have to let me know of the investigator they found when this investigation starting. There's some committee boards that they review these things, and then they put one letter, but the patient, the human, has to follow up, or they don't do anything. Then I stated, oh, this is supposed to happen. Oh, okay, I'll find an investigator for you. I said, you're supposed to find one already. You said you were. Oh, no, okay, I'll do it. I'll call you. I'll get the investigator to find. Okay, then, and then they do their job and try to find one. A human has to follow up with these people. That is already supposed to be done that day right away. It's not like there's a million doctors every day that they deal with. They could easily phone the doctor, find the patient record that I even had to send myself, could easily they access. The files, everything's online, takes a second. Read the doctor's file mine, is there approved mine, and see they're medically negligent. They wrongly put ACT, other things there that endanger my life, obviously, that a normal medical doctor that's capable and cared for human health wouldn't do to me. And they did wrong illegally is punishable illegal human torture to damage a brain woman and have side effects when don't need it all. And they don't even, that takes the second few minutes to call them, and it turned to second weeks, calling them months, and they don't do anything. And these doctors, human crying and see that they're wronging other patients, are still working there. All of them have the phone number, so I try to follow up, even call themselves, but I cannot. I can call, but the office's secretaries tell me that the college is dealing with the doctor, and they can't. I can't speak with the doctor myself. The secretary cannot tell me if the college called them or not because the doctor deals with that. I right to know. A human, if I had money, I would sue, and they have to be in prison. They bodily harmed. They harmed a human brain, a life of disrespect on the earth. They're still walking around there, and it's true. I human care every day. I have no money and put them in prison. I write to my chosen intelligent human to take them to court and see them and put in handcuffs, and I'll walk there with them to the prison cell. And I tell them in the eyes, 50 of them true, medically negligent doctors and psychiatrists. Nurses and practical nurses and registered nurses that also went along with the files. I told them as well, I do not need these. I don't need this medication. Tell the doctor, lower it. It is over sedated. I am. There's too many side effects. I didn't even choose to take it. I'm a lady. They barely. The doctor deals with this, or they make up something. They some study even more for registered nurse and do nothing. They do nothing to help anyone. They stand in the office, put a sign when they have break, and then a human walking around, and then a human knocking on the window when they're 2 weeks with no blood left to ask them for food. Say, can I have a glass of water? And some of them, there's two ones that care. The rest are on break for life. They're always smiling. When they go to their job, leave. and always on the cell phone, planning, talking with the family, planning their vacations. While they make wrongly a paycheck and never help anyone, a human begging for food. When I have this and I need help, and there to be right away. To humans fighting for their life, to saying rejecting misdiagnosis of schizophrenia and catatonic that no human has. Psychosis, NAS, mania. I choose this gone from the world. I'm an intelligent human, but I need other humans to help me. These are all general terms. There's no human can be admitted for this and wrongly prescribed, especially any dangerous antipsychotics that harm a human health brain more when they don't even do anything to help the human, and the human doesn't even have a specific mental health brain problem or concern stated by the physician first or psychiatrist, doctor, GP to state, okay, you have this is your symptoms that you have. You have this certain mood disorder. Exactly, this is what part of the brain it affects. These are the symptoms you have, and the human agrees if they really do have those symptoms, can ask for a medical scan, brain scan, or assessment, further blood test to prove some of them medically that they do have that mental health or physical health concern. But other ones, like these medical doctors, most medically negligent psychiatrists as well, they come in and state, oh, human, oh, you might have you have dopamine imbalance. And then the patient said, how do you know that I have a bit dopamine imbalance? I'm feeling fine. I don't have any dopamine imbalance. And then keep in mind, dopamine imbalance is there's no medical way to prove it in a human being. There's no medical scan that can actually prove that a human has dopamine imbalance. Dopamine itself, if it's lowered or somewhat in human health, can easily be raised. It adjusts itself in the human physicality and brain easily over time by itself in the human being. It doesn't need any dangerous antipsychotics, clozapine, olanzapine, risperidone, paliperidone, ECT, Abilify. All of these I was wrongly given and stating over time to patients. That's why I'm telling the truth for many millions of patients in the world to please what it is and inform all other humans, especially in Camh Emergency, Mount Sinai Hospital, the psychiatric units, mental health wards, long-term care facilities, recovering facilities, especially those in the recovering of drug addicts, alcoholics. These are mental health wards that these medical doctors and psychiatrists are morally most did wrong and prescribed to humans that need their brain already been either has damaged and needs to promote them to have a healthy lifestyle, to go outside for air, to exercise, so proper circulation to the heart and brain, oxygen, to have proper health, the proper diet with low fat, with enough sugar but not too high. These main things, the vitamin D is easily gotten from the sun when not on any the other medication in case. And this helps the immune system and physical health and bones and everything in a human being, and helps the mood of a human already for easily simply from being out and absorbed through the skin from the sun or get supplements. The vitamin C helps human immune system, A&E, the antioxidants. The omega-3 fatty acids help the brain and heart. Potassium helps the heart and the brain, that helps human mental health. Uh, and there's zinc helps the human health. There's a lot of vitamins and supplements that humans can take, even a lot of nuts. Humans need that help the brain, the human mood. Humans can internalize certain foods, meats especially, that have proteins that have smaller, broken down to amino acids that actually make the neurotransmitters in the brain, serotonin, the dopamine, and this all the rest in the brain and physicality These are to be internalized for humans to have a proper diet of these proper green leafy vegetables, to avoid white floured pasta and types of white bread food items, for humans to internalize with no gluten if needed, to to internalize whole grain or whole wheat instead, and be a lot healthier and healthier, and helps the human physical and overall mental health. These are simple main things, and is a good diet, exercise, to go out in the sun, to be happy, to live your life, to do what you choose in a safe place with a happy, nice people, intelligent, caring environment is best for all these patients to be in, to live in, and these medical doctors know, the psychiatrists know, even for humans with depression, this is best for humans, for even cognitive behavioral therapy, for the to teach them to think of what is not to think of what is already been wrong, that and to do what was wrong to them, and to avoid thinking about it, to first think of their health, to find what brings joy and happiness to their life, to also associate themselves rather with these kind-hearted humans that care for them to care others, do something what makes them happy, makes others happy, to focus their thoughts first on their lives, and to have a good exercise and diet. These are the main things, even supplements if needed, certain ones to help. These are what all these humans need to go out for air and have a proper diet and exercise and live a happy life, do what they choose. Especially those recovering from after doing some drugs or alcohol intake. It doesn't help any of these patients recovering from such things to be given wrongly prescribed clozapine ever, olanzapine, Abilify, especially not, risperidone, definitely not, polyperidone, definitely not, ACT. This is this is beyond wrong. These kind-hearted, most human patients still walking there and kept in these places, some illegally on forms, and some not educated, don't know about this. These medically negligent doctors, psychiatrists don't even inform these patients. So they have a patient there, make the paycheck, as I stated, say, I'm gonna, how's your mood? Standard question. This is your prescription. And then assail in 2 weeks or when they're gonna see the next time and leave. And the patients either get their prescription there or have to go to, especially clozapine has their own pharmacies, have to be to a specific pharmacist. A lot of pharmacists go along with the medically negligent doctors, psychiatrists too. This is a big, this I choose everyone to help any medical staff is not easy to do for a human that's a person that has no contact information to the head pharmaceutical companies that deal with clozapine or clozaril and these other dangerous, really harmful, never beneficial to mental or physical health antipsychotics, first generation ones, second generation ones. These are, according to me, and I'm a victim, lived through these. I know the side effects. I lived through in a woman and seen 100 million patients and illegally, even most given. Do not help any human health. They endanger the human life. A human is in brain, essentially the memory thought process damaged for life, over sedated to tired with exhaustion, physicality, have 100 million harmful side effects they don't choose to live through. They lose their friends, they lose they cannot exercise, they become ill to overweight, their sugar levels wrong, they potentially some get, especially clozapine, some might develop actual diabetes, have sugar problems, and then their heart and circulatory system is damaged. They cannot work, they cannot drive, their thinking ability is impaired. They cannot do anything in life. They cannot have a job. Then on disability in Ontario is beyond disgraceful. It's one of the well-known provinces, countries in the world. This give $200 to $1,000 to a human can live for maybe a week, maybe with some food, but it's not enough for rent, not enough for shelter, not enough for clothing, not enough to save anything ever to live. There's not enough money to even put aside someone happy to buy a gift or anything, vacation ever to save. A human in Canada is homeless, essentially, when he's on disability. And there's human then begging on the street, brain damage, most illegally given these antipsychotics dangers which I choose gone from the world. I'm only one human, but I even need other staff to help me with this. These are 100 million videos still, and these doctors, psychiatrists put their name to it and faces, and 100 million comments over years, where they're wrongly misinforming patients and the smiling. I see, I know the truth. Which ones are the proper doctors doing caring, which are not. I lived through the side effects. I know what they are. I'm an intelligent human with a life science degree in all medical knowledge learned of all fields: genetics, neurobiology, physiology, all the rest of them, anatomy, and other ones. The research I did, worked in other labs. Angelica Jikela and human, I am human on earth, on humanitarian side. I care to help any human alive, would do anything to prevent what any human living through what I suffered, especially when the governing bodies are not doing anything to monitor these doctors, psychiatrists, and they're judged under God immediately on earth too if they're hiring medically negligent doctors and psychiatrists and not following up on this, not taking away their license and not hiring them in the first place. This and they would rather give someone and have to do morally obligate under God, the colleges, the College of Nurses of Ontario, the College of Physicians and Surgeons of Ontario. This is Ontario, province in Canada. These are the other main ones there's a million provinces well known in Canada alone. Then the states, many cities. There's Angelica Chu's the Prime Minister in Canada and the President in the states. I am telling this also to the Pope, current one, Pope Francis, other world leaders. You have to look into this. You haven't been doing your job. You're morally obligated under God. You cannot make your paychecks if you're disrespecting the human dignity of all many patients and other employees and different humans you know and governing college years. You have all the resources to check and monitor that they are hiring staff and letting into the countries humans and that are potentially and medically negligent doctors and psychiatrists, nursing staff, registered nurses, practical nurses, physiologists, specialists, neurobiologists, clinical scientists, researchers, a lot of professors in a well-known university, in the University of Toronto in itself is a well-known school. It is a very nice school. But the staff has to be employed there that care for the well-being of the students, of the human, to respect them, to teach them morally right, to care for human health and what they're teaching them about. If the doctors and psychiatrists are affiliated working there and illegally harm humans and give teaching them results of these illegal human trials, research done on humans, a lot done illegally in Canada from Camh, especially there's 100 researchers did for over 20, I was there 20 years, affected by these illegally wrong, morally wrong, unethical human beings that did illegal research pushing dangerous antipsychotics, have access to other specialists were going along with brain scans doing to improving their illegal work and wrote the journals, psychiatric, medical, well known journals that don't even make sense and have wrongly informed potentially these students that are a lot paying money and poor some in Canada to be educated to become medical doctors that look up they need a good role model, a good professor, a good lecturer, an associate professor, a clinical scientist, researcher that did care, that did actually do morally right and found actual real research results on humans by free will of choice and real medically proved uh, ways to treat a human mental health concern, did is morally obligated under God, right, and did what is in job description to do to find vaccines or cures, treatments. Treatment is the term is used to treat a certain health concern, to help that health concern, so human doesn't suffer it and doesn't have it anymore. To treat it, there's therapies, this terminology to help human health, physical as well, and mental health. Not to use their what they did illegally and put into research papers published. I don't know how they're published into these journals, medical journals, the psychiatric journals. They're on PubMed. The other well-known, many, these hundreds of these well-known journals and online sites that are humans reading, that are a lot of them, and I'm a medical basically student, educated at university level and did research over time. Angelica, innocent human, and lived through side effects know that what they wrote in these articles, journals that they publish, is illegal on human based on illegal human trials and is resulted in whatever they wrote there and potentially teaching to pay other students for years, unfortunately. Their works, which are not based on true facts, is beyond based on immoral, unethical works of disrespect of human life, which they don't state in their journals that they did illegally on human patients, that they wrongly misdiagnosed humans and wrongly they treated them and did some illegal research on them and went along with different got scan results to prove a certain mental health concern that a patient wasn't actually tested for, wasn't scan had the brain or physical health assessed for, wasn't given told that stated that this patient didn't choose to go through these procedures, the scans, these these didn't choose to take these dangerous antipsychotics. They were not stated that these patients were put on illegally on forms to stay in mental health wards. These are not stated in these medical journals, the most psychiatric journals. But this is what happened is true. To hundreds of patients, this is in Toronto alone. I've seen the videos. This Beyond Needle taken misinformation off YouTube and other main websites, with the videos especially misinforming patients. These doctors, human cry, cannot watch this. I know what I lived through, but these humans, and I'm intelligent, other humans are not educated in medical matters, in psychiatric terms, and are being misinformed. And even the ECT main, these sites, even on Camh, after all these years, the main websites, most of them state the basic what happens during ECT, but they're not stating how serious the brain damage and memory damage and how serious these side effects are. To state of a human having damaged veins, venipuncture, to fasting hours before general anesthesia is given to them, they are knocked out cold. They are not aware what is, they're knocked out cold, and then two electrical wires taped to the brain, the side of the head rather, an electrical current passed there. A human basically electrocuted brain and body, shaking while knocked out cold. Emma Lady lived through this. A human fears for their life. There's no human alive want to live through this. I understand medical things what I other the doctors what they're doing. And I even tried to get this out of not to think about this while I'm living through the procedure. There's other patients that don't know about medical matters that fear for their life, and I was against freedom of choice given this illegally. When a doctor's standing there stating, "You're doing fantastic," but it forced me to go there legally, to have my brain electrocute basically and have seizure, which no human needs to have, and damage my brain more in physical health and memory for many hours to days at time and for life. I was done this illegally, had this done to me over 10 times a year. I fought for my life, but they put on forms and these doctors I couldn't get out till I finally got an intelligent capacity board member and went through, took this doctor to court with the consent and capacity board. And finally, after all the years, did get one intelligent board member. That did state the doctor, psychiatrist told him to essentially stop talking. You're not intelligent. 3-hour board meeting. I told what happened. I was intelligent, and the board member on my side stated this patient, Angelica Gichella, she's a university student and in life science educated. Told this psychiatrist she told you and she doesn't have a mental concern. Why'd you push these dangerous antipsychotics ECT on a human when it even said that she was doing fine and stating that that to prevent relapse of symptoms, but I didn't even have symptoms to begin with. This could easily be done by any other doctors and board members over years, but there's not many working there. And I could have avoided having been lived through this if the doctors cared, did the job. The medical doctors, all the mostly psychiatrists, basically don't even know English, half of them rude. Is they wrongly even assess a child. There's some old people there, most old can't even walk. It is beyond a human is disheartening to see. They still live, they're staying there. Beyond poor, go out because they don't give them food and go out begging for food. Wear the same clothing till it's worn down. In Canada's cold, they barely have a jacket worn for years, and wear the best they can to clean it there. And they need there's no and they have a multi-million-dollar buildings in Camh. They're empty and could have had that funding and give the social workers the two human care but need donations or people to help them to promote this. This in Canada, there's a big. These prime ministers, and in the states, the president. These are morally right under God have to do, or they cannot make the paycheck along with those colleges and boards below them. That they have to check that the employees, but are not doing the job to care for and respect the human rights, the patient rights to be respected as a human being, human dignity of God within human values to be respected as a human with a life, a soul, a human health, brain to be respected, to be healthy in physical health as they would want to be respected, to have a proper medical doctor employed that cares, to assess their proper mental and physical health, a proper psychiatrist, a neurosurgeon. These are humans' trust that they think these doctors and they study many years and swear oaths to God to help human health. Humans trust these people. A lot of them are unfortunately medically negligent. These are over 50 of them unfortunately still working there after I was wronged for years, and they're still making the $1 million. And so they're still doing affiliated with the University of Toronto and other ones, working another job as a professor, assistant professor, head clinical scientist, researchers, and then the nurses, the other colleges. I didn't. This is I already filed these complaints, and it's truly been almost over a year. And I following up, and then on this state investigation going on, we'll let you know. Then I follow up, say, oh, okay. Then another letter finally. But if I didn't contact them, they're not gonna look into the file, see if they got investigator. A human has to push the issue on this earth for everything. And most people poor in these situations are bad enough, didn't even choose to be harmed, were illegally harmed, the brain, misdiagnosed, with not even a real term of medical validity, a general term: schizophrenia, mania, bipolar disorder, schizoaffective, psychosis, psychosis nos. These are all general terms. These are not. These not can be used in court. These are general terms. They don't specify a specific mental health concern. They don't specifically state, okay, this part of the brain is affected. These are the symptoms. This is how this affects your physical health. This is the brain maybe problem you have. This is you have this this affects your mood this way. These are general terms, and 100 million people, as I stated, wrongly admitted, and still. And online videos, and this huge count after all the years humans suffered, no one looking into this. The Pope not doing his job to monitor, check on this ever. In many things online. The world leaders are not doing this. The president of the states, the prime minister, these are then especially in these countries in Canada, in the United States, in Australia, the main these in the world, well known, especially where there's most of the people go there are saying these are lands of opportunity. They have more money than other poor countries. These are humans come to Canada stating that they come here hoping that they'll have a job one day, they'll have a nice home, a safe place to live with no war, to have money to raise a family with nice people, different nationalities getting along, respected as a human being, have enough food to live, money, paycheck. This is not true. This is not what humans live through in Canada, in the States. This is not what humans live through in the main countries in the world. This, I have seen it all is true. I've seen the news. I lived over suffering over 20 years. I was firsthand seeing this and I know medical terminology. I know I chose to be a medical lab researcher. If I had money, I would have went to surgeon's college because I believe in the oath that the surgeon swears to do anything under God to find a way to help human health so humans don't go through surgery. I chose to and do research but couldn't cause brain damage for years and do genetic had ideas for to cure find vaccines for all genetic autoimmune diseases, for cancers, for allergies, for asthma. I couldn't do after I did my university degree lost because of the medically negligent staff. Doctors and psychiatrists wrongly prescribed dangerous, really harmful to health antipsychotics, especially a woman doesn't need. There are all 100 million websites. Still, I'm only one human. There's no one looking into this. It takes a second, even a doctor, to take out of their day that cares, that knows the true medical terminology. To look online, there's even a few only medical head facilities have misinformation, hundreds all over the world, online websites. The ECT itself, even Camh, after humans suffering, humans see this. It's beyond wrong how these humans still smiling when a human and illegally giving this to humans, young and old. There's a brain damaged children were there. An old woman that can't even stand clearly doesn't need already brain damage. And forced every week was there every 2 weeks or 3 weeks that was illegally put there, and they were there too. Had to get up in the morning cold in Canada, get up early and fast for hours, and then illegally in vein inject this damage the vein, put a general anesthesia, and what no human lived through. I put an oxygen mask on a human, then knocked out cold. Don't know if human gonna die or not. Don't know if the human is gonna they wake up with no severe memory damage for sure. but know how long. Other potentially something can go wrong, and a human be nerve damaged brain for life, can't walk. The human wake up and is beyond wrong to change. If anyone hears this, please help. If it and it still go on, the human to wake up a patient in the same room, respect their life. When a human memory is damaged, knocked out cold, and they did to me and other places do. These ACT clinics, wards, the Camh has this, the brain Temerty uh, is a center, the new one that deals with ECT there and other brain scans that I choose to look into, but medical staff are more experienced with these and knowledgeable over years. Could help and get rid of this excessive is proper to human health and get rid of it once and for all after over 100 years. It doesn't help any human health. This is beyond illegal when against free choice cannot be prescribed ECT to a human. I don't know why it's still called ECT. Electroconvulsive therapy is never therapy. It damages the human brain. It electrocutes a human alive with not enough nutrients injected with general anesthesia. And then a human with a and then knocked out cold and have a electrical wires tape scaring human to the brain, to the both sides of the head. Electrical currents passed into a human brain. Physicality shaking electrocute alive. And the brain then is it doesn't help anyone. Is a seizure. There's no human alive wants a seizure caused by electricity passed through a human brain and physicality. And to live through even the medical rooms. I understand medical terminology in buildings like this, what they are for, but other humans not educated do not want to see these. I was illegally wheeled in not enough blood was happened to be overdrawn, and I fought against this for years too. Always these staff medically negligent and swore to God, checking for human to get blood work. A few hours barely go by. Blood work. I said I just had blood work. I don't need it anymore. Another one till the next day or proper timing, and I'm intelligent. Other humans don't have blood work. A human lying there knocked out cold, not enough blood overdrawn, and then a wheelchair, and I don't even need to ECT. A human can't even sit there. Too weak to sit there. Doesn't need at all. They stayed over the years. Lowered other medications I didn't need, stating you're doing fantastic. Then I said, why are you putting me here to ECT for? I'm against this entirely. I don't need it at all. But they're smiling. The human wheelchair to the brain electrocuted. Angelica Jacala tell all humans, and but it's not only nursing staff. There's physiologists work there for years. That building in Camh ECT has been torn down years ago, and the staff working in the new one is there's this new center, the Temerty. The owner of this facility and has other multi-million dollars building the new building medical one in the U of T, the University of Toronto, has to look and is morally obligated under God to check out his employees, to make sure the employee there's a board member that is still working there illegally that harmed me, and the chair of this department of the brain. There's a brain therapy. They have the ECT there. They have the other two different brain scan or brain procedures going on there already for years. The staff that used to work ECT is working there. And this staff is already the one I dealt with. And the other ones that I was assessed first, there's the nurses, registered nurses, did the blood pressure check, EKGs. All day staff trained morally under God went along. I told each time I didn't need check the patient files, and still illegally went along with me having my brain electrocuted. ECT, electroconvulsive, is not therapy, is not therapeutic, doesn't help, is illegal human torture, and a human is rightly have these humans put in prison right away. And they're still working there. They tortured other humans. I've seen is not is saying is true. And there, unfortunately, after these colleges, That they had the board members, these trustees in Camh are not doing or they're morally obligated to care for the humans, the rights, the patient rights, to respect their freedom of choice, to respect them as humans, their dignity of God within them, to be respected, valued as a human being of every nationality, to respect all these employees, the patients, women, children, properly all times, to employ proper doctors, psychiatrists, staff that work there, physiologists, all the secretaries, medical secretaries, the pharmacists. They're allowed working with the clozapine alone. These are most of them what they're hiring are medically negligent staff, have been working there, some that I know of, over 24 years. They harmed the lives of hundreds of people rather. Over the years, so they write a write a prescription rather, sorry, and leave. And so they have a patient to come once every 2 weeks when they have their expensive briefcase. Their suits they wear, hundreds of dollars suits, $1,000. They have their own colognes, Versace, or I don't want to say brands, but is expensive brand names. They all are well fed, well rested. They go from their $1 million homes. They have vehicles parked out, as I stated, that cost $1 million. Today in Canada, in Toronto, Lincoln Navigators. These are huge. They're not the simple vehicles. These are the luxury vehicles. They have leather interiors, well made. These all have interior heating. These vehicles cost more than a house in Canada. Some basic ones even. They cannot, these, and the patients that they deal with are poor because of them, like me. I'm homeless, essentially. I've been disabled. Disability gave me, I barely had $2 for 2 burgers that last for a week, and I have to live off that too. Rent, which I can't afford at all because it's not even money enough for food. And I need help. This is not what one human can do. A human starts this, but needs other humans to push the issue as well, as many times needed with these heartless humans that swear oaths to God, every human, religious or not, in every job title, starting with the head in the countries, the prime minister in Canada, the president of the United States, the other world leaders, the religious world leaders, the Pope himself. The Pope is God's representative on earth. These all head world leaders have the resources under them and are morally obligated under God to respect all human dignity and all humans, to care for their health and well-being and safety all times. Then employ under them those humans that they think are properly morally right to do right about this as well. And then those humans employ right people, the doctors, psychiatrists, first the board members, then the colleges employ the doctors, give them licenses. Psychiatrists have to assess them properly if they're capable of to treating a human with respect, to care for the health. If these all staff don't have intent of helping a patient, a human being, if they're not going to respect them in every way, then they cannot make their paychecks, including the prime minister, the pope, the president of the United States, the other world leaders, religious world leaders, are morally obligated, have the resources, the doctors themselves, the others employed, secretaries, the board members, trustees of the medical hospitals, mental health wards, long-term care facilities. All of these are morally obligated under God to do their job description, which is to care for humans, their well being, their quality of life, to promote proper health, to respect their human dignity, their value of a human life, to be respected at all times. Most of these, except for two people in Canada, the States, in the main countries, in Australia, and other parts of the world, unfortunately, are not doing this. They are not monitoring anything. They have all the resources easier than one human me could do to find and call even these, contact these and look into these pharmaceutical companies. These companies are making multi-million dollars off of clozapine and these illegal antipsychotics and not looking into who's prescribing them. They're making wrongly $1 million of this, and humans are suffering illegally tortured. And the medical staff getting away with this, making vacation money, writing a paycheck, put their name to it, write a prescription, wrongly stating, here's your prescription for clozapine, the main ones, olanzapine, risperidone, Abilify, and the polyperidone. Then the other ones, ECT. ECT is a procedure that has general anesthesia given. There's a venipuncture involved. There's many employees employed to go through that one procedure to deal with a patient alone, over 10 people. There's a physiologist, registered nurses. There's some neurospecialists, brain specialists, surgeons. There's the doctors that go, a psychiatrist is present. These are all employed, make hundred thousands of $2 million in a paycheck a year, and have to do morally right to help the patient, but are not. Most of them, and I even have online, they have the nerve and disrespectful of patients and no right to do. To smile, I know which ones tell the truth or not. I'm educated these and I lived through, I know these are still have ECT. I choose everyone, please help take down every video as is misinformation. Is not beneficial to anyone's health. Brain health, especially depression. This has long-term damaging effects of memory. And other humans, some can't remember anything for life. It is not a risk for anyone to take to be not enough nutrients given after having to fast for some hours. And then have their veins damaged. Could result in a serious injury. Human have wrong clotting or something harmed there. It endangers a human life. A human is in pain. Humans have emotions. A lot of people don't like needles. Put a needle, venipuncture there. Put a general anesthesia. Human is knocked out cold. And a lady, I seen these and I know what I lived through, but I see the videos. No human want to see when it actually happened. When a human see another human knocked out cold, what actually happened. When a human is knocked out cold, don't know what is going on, but it electrocute brain alive, and the physical is shaking. And a seizure. And a human, a lot of them, women, there's children. This is illegal. If given against free will choice, not allowed, given to humans that don't choose to go through it. But I was given it, and other people forced to go through it. Over 10 times a year, some humans unfortunately still going there after I left. Children that clearly don't need and are brain damaged, and old people that don't need at all. They can't even stand and shouldn't even be there at all. And all staff medically negligent, smiling. State how's your mood? The blood pressure. I said I don't feel good even to reschedule the appointments. Could easily do every day. No, this is your appointment. I have rights to say things, but they force me, and they 10 of them standing there, all the different fields stand there present and said you have to have your brain electrocuted. ECT treatment. I said, what treatment is? What the treatment is not treat me. It doesn't help my health. I don't need it. It's gonna damage my brain. I'm not gonna have children if I have a damaged brain. I can't have a job. I can't do anything. I don't need this. Uh, is your treatment? And I can't tell them off because they're gonna call security. And I tell the truth, but I need I need a lawyer, but I couldn't afford a lawyer. I'm an intelligent human. I have a lawyer present, but I can't afford the lawyer fees. I am a human, and disability has not enough money to save ever for lawyer fees. And these people get away with it. Every doctor, psychiatrist. If I did, even I would pay the money, 30,000 for one day of court, which is beyond wrong for human that wrong a life and need money to live now, and take away these doctors' paycheck and give to me what I could have made those years need to just buy a house, even basic one, to live so I don't live on the street in the cold. That I could have used my university degree to save money, have a child, and live my life as I'm supposed to be respected and do, but I couldn't because they wrongly made a paycheck, went on vacation with that money. They morally knew they were doing wrong, and still no one in the department college ever assessed them, ever checked how they were doing, what the research is about. The University of Toronto is affiliated these professors, psychiatrists, and medically wrong doctors for years, over 20 years more. It is a well-known school. I studied. There are many professors that are really care for students. They do their own research. They study. It's not easy studies. They choose to help other students learn what they learn, anything new to help them. But the other ones, they're not aware of the departments. I emailed, don't even reply right away. This is a serious matter. If someone heard that a patient was wrong over the years, and then they would in the office and reply right away. Like this is everyone most is making unfortunately paycheck purposes and not doing their job are judged under God and cannot make their paycheck because their jobs are sworn under God, and every job that affects when they hire other people, when they teach students, teachers, professors, then these medically negligent doctors, psychiatrists cannot be professors. Make a paycheck that is made to intend the purpose of helping students to teach them something morally right, to teach them about proper human health if they're doctors, depending what they're teaching about human research done or on animals, to ethically treat them right, to teach them to right as well, to be proper doctors in the future, psychiatrists, nurses. They're morally under God, doing wrong, and they're wrongly misinforming students. They've been working there, especially in the University of Toronto, unfortunately, for over 20 years. And they're still working there. And the humans, I see the patients crying when they see these doctors, and they can't do anything because they don't have money for lawyers. They have a patient rights advisor, but that only goes so far. The rest need either take to court, and a lot of the main ones to get a board member can go through that certain forms to get rid of in a human I was put illegally on the doctor right away. These ones do, these medically negligent ones, and psychiatrists find me incapable of consenting to treatment. That's why this is beyond wrong. This is illegal. They cannot do to human as intelligent and doesn't have a mental concern. They have this form there, and they put a substitute decision maker making treatment decisions to accept or reject a treatment that if I don't agree with and I'm intelligent, can make decision for myself. If for some reason maybe a brain injury, they find someone a substitute decision maker to make act in my best interest, the decision I would make to accept a treatment if it's proper for me or not, a medical one, or antipsychotics if I need it or not, ECT if I need it or not. These medically negligent staff put forms on humans and other ones I know of for substitute decision makers that they know are not educated in these matters, and some not knowingly even are not informing them and telling them, and substitute decision makers, STMs, by accident don't even are not educated enough and trust these doctors, psychiatrists make wrong treatment decisions for patients that the patient is against, and they can't do anything the patient to stop this from being given ECT, from getting clozapine, olanzapine, risperidone, paliperidone. There's many other ones. These are Abilify, aripiprazole. I state both names. Each of these have the main name, and then there's the commercial names. These are the main ones that are beyond harmful to human mental brain health, are never a cure, keep in mind. They never actually cure a human mental health brain concern. They cause more harm when taken over time than they help. So I recommend no one take them at all. They don't help anyone. They are harmful, beyond harmful to mental, physical health, and humans to avoid these and avoid mental health hospitals unless you know there's someone there. And to be admitted, make sure you don't enter there unless you have a human, real caring medical staff or psychiatrist. Don't be put on any forms. Walk away if you think that they're not acting in your best health interest. Once you're in there illegally on a form in Camh or Mount Sinai Hospital or 100 million in the world, If you get a medically negligent psychiatrist and you don't trust them, walk away, because they're gonna they put on forms, so they have a paycheck to make a patient to sign their name, a prescription, even misdiagnose, so admit for a number of days, so they have a patient to assess after 3 days. A human suffering there could be assessed and have to right away. Some put a form then for the human patient to stay to ask them the question about their health after 3 days. And a human cannot they can get a rights advisor, but it cannot act till 3 days. 72 hours. I human illegally know, that's why I'm saying this, for humans to avoid these places unless needed. If it's emergency, get emergency advice, obviously. But if you have a mental concern, get a basic doctor, someone. It's better to promote your proper health, better nutrients and exercise. There's no antipsychotics gonna help anyone. There are some medical specific medicines that are medically proven that might help someone brain health for a specific actual real mental health or brain physical health concern. These need assessed by a real doctor, a credible psychiatrist. There's some that are beneficial to human health, but there's still any medication needs to be have all information by the patient looked over to make an educated decision for their own health, to choose by free of choice to take it or not, to us to think through the doctors acting in their best interest, recommending this, to think of other possible ways not to take medication, to find supplements, natural ones if needed, proper food first, exercise, cognitive behavioral therapy, where humans get a counselor to talk things through, helps even instead of taking any medications first. These are things humans have to consider. And it takes a lot of people, unfortunately, and patients, especially with even brain damage, mental concerns, are not educated in these matters. Trust the doctors, but most are not doing their job, not informing patients, not caring for the health, especially in mental health wards. In Toronto, this is the main huge city in the center downtown Toronto. Camh, Center for Addiction and Mental Health. The emergency area, Camh, there's huge buildings. I know there's the new Temerty Brain Center. Angelica and unfortunately, the College of Physicians Surgeons of Ontario is not doing what they're morally obligated to do. These doctors have still worked there for over a year since I filed the complaint, and I could have sued, but I have no money to do because obviously I'm disabled because the doctors wronged me. And I didn't even need lost 20 years of life and homeless in Canada is too cold and I have no money to live. And no children because of them, and I can't be on wrong, so no have some way to get a lawyer to sue you and find a way to do a small meeting to put them in prison. They bodily harm illegally a human being life. While they went on vacation and couldn't do that, their job paycheck is not made to do. The colleges didn't look in to prevent this. The board members that hired these staff, the other ones, secretaries, the ones dealing with clozapine, especially the pharmacists, go along with it. Some care, some don't look into this. They write they take the prescription rather given by the doctor, psychiatrist, and give the prescriptions. And this is make the $1 million, and the patient saying I don't need it, even to psychiatrist, look, the doctor gave me this, I don't need it. Oh, but the doctor deals with that. Doctor prescribed it, but I really don't need it. And then I even say to tell the psychiatrist, I'm intelligent human told, call the doctor, tell him this, I don't need this. These I already says this. They stay know the doctor. They don't even call. They get put the prescription there, and the human has to go and take it. If they don't, they're put on forms illegally. Some like myself, and if I don't take it, the police gonna show up and they're gonna take me to the doctor's office or hospital, to Camh emergency or Mount Sinai emergency, wherever the building is, when I'm not an inpatient, and are gonna force me to take it. clozapine, olanzapine, Abilify, risperidone, polyperidone, ECT, and a human cannot be disrespected life this way in fear for their life and no way out because they have no money for lawyers. And a doctor is medically negligent, and psychiatrists harmless could have even easily assessed, even me years ago, a child, oh, she had blood clot. Clearly, any medical doctor sane would see she needs these blood thinners, proper one, assess my health, blood thinners. She's dying here, have blood clot. We gotta help her health, medical ward, not mental health ward, medical ward. But there's humans working in Canada making the paychecks. The doctors, psychiatrists, most of them. Then the board members above them, trustees, committee members above them, those ones. The ones that run the facilities, that make the pay the money, the owners of the actual medical hospitals, mental health facilities, Camh, Mount Sinai Hospital. These are the ones I dealt with, that I was there. I filed complaints with these, but I have no money for lawyers, and they wouldn't even pay off because it costs so much to to sue them. And for the facility itself, they employed the wrong employees. They harmed my health, disrespect me as I'm a lady. I didn't deserve to be mistreated that way. I have brain, mental health damage, physicality, memory damage for life. There's some were rude. There's a human put in places, now that there's another lady to be illegally. 3 days freezing to death with no food. Once admitted, don't choose, could have left to medical concern, assessed properly and left. They put on form this, so they have another psychiatrist or doctors assessing it in an hour. Then hours go by, then wait and start to put me in the building and another form to stay there for 3 days I didn't need. I had to go to a medical ward or hospital. They're wrongly putting on forms that I don't need this. Then to get the other humans have the jobs, the rights advisors of the patients. This is all. Most of the rights advisors care, but a lot are not doing their job either. And the humans phone one and they transfer to another one. These rights advisors can't do anything for 3 days, which is wrong with a human really, and as the human has to have a lawyer. But no human disabled has money for a lawyer, can't even have money, doesn't have for food. And living on the street, there are people there in that building, Camh, has empty building rooms. A lot of patients that were wrong there on disability, ODSP, cannot afford a house, even that one let go from Camh. Didn't need to be there, illegally harmed, have no money to put a lawyer, sue some money to live, put the doctors in prison, put the psychiatrists in prison, is resolved then. They cannot do because they can't afford the $30,000 court fees. The medical negligence lawyers could easily win, but no money. No money for clothing, no money for a house. Then the housing, human on I know is on in Canada for over 10 to 20 years waiting list. Even disabled people that don't have a job or even medically wrong could easily do their job for years, but the doctors wrongly made paycheck and prescribed them antipsychotics, damage the brain, and have to live on the street in Canada is beyond cold, sub-zero temperatures most of the year, and live on the street begging for food, homeless, with a brain injury. And a damage didn't need, and were kind-hearted people and are, and could do job for years but couldn't, can have children, and sitting freezing to death outside begging for food. And have basically the clothes on the back for life, and cannot get a job, are disabled and nowhere to live. Like I'm myself homeless. Angelica have no money to live, and I was wrong in my youth when I was figure skating, put the effort to be healthy, could have skated, could have taught goaltenders, NHL. I had a human intelligence, life sciences, actually chose to do medical lab research, studied all fields. Would have had to find and ideas to find vaccines, cures for over 20 years. And I was wrongly had damaged brain, none helped on the earth, not respected by humans I know in medical field, chose to deal with real doctors. And if I could have money, like I stated, be a doctor, go to medical school or surgeon's college. I do anything to find a way to find cures, vaccines, any health way to help a human health so they don't suffer. If they have one, to find ease the suffering as soon as I know. Anything to remove, to find cures, to help their health, to find ways to donate, to help social workers to find. That's what I chose to do, but couldn't do for 2 decades. And 100 lives is not a saying. I didn't send one human studied and ideas on God's side. I am a human earth angel. I would have other assistants know on God's side too, could have done research and assisted and had every cure and already this all COVID gone and assisted other researchers in the world. I could and chose to be a medical lab researcher and do research, and all the many vaccines could be cures found that I thought of other humans didn't. A million potentially over 20 years. That's what I chose to do. I could not, and I can't live with this, and a brain damage couldn't do because these doctors, psychiatrists, wrongly mistreated me, a human being and a woman. I couldn't have children, I don't have for over 20 years. It was illegal. And I have to live now homeless in Canada is beyond cold. No way, I barely get the ODSP is nothing. There's no way I could save even over years from that. I don't have enough money even to eat from that, and not even to last a week. And still, this going on. I choose everyone to hear this to get funding. Prime Minister, these other ones in the states, I'm not sure how much disability they give, but it's humans have a lot even medically negligent staff, illegally wronged. You hired medical staff that swore oath to God. The governing colleges and these ones you didn't check, monitor, had all the resources. These ones and head ones mainly of these hospitals, these are some board members too, affiliated with head universities in these countries, Toronto University, University of Harvard, illegally teaching there, did illegal research on humans, pushing pills, making paychecks for vacation money, swore oath to God that they would help human health but didn't, wrongly published journals, psychiatric medical ones, wrong misinformation in each one, based illegally on illegal human torture, bodily harm of brain organs with dangerous antipsychotics, ECT, other brain procedures beyond harmful, never cure anyone. They never help human brain physical health. The most patients admitted under schizophrenia, psychosis, NOS. This is not a real mental health concern. There's no specific symptoms stated. Even this in the world and is not monitored and get rid of videos on YouTube. Is not monitored. The head facilities have multi-million dollars. I see these new buildings in U of T, in Harvard, in Australia, the head main parts in the world. These buildings cost $1 million, but they pay these doctors, psychiatrists, nurses, physiologists, surgeons, board members, ECT clinics still going on after 100 years, never help a human life. These are people acting on these videos that they helped. Not one human is helped with ECT. This is illegal and against freedom of choice, and a lot of given over the years. These all websites have misinformation of each one still, unfortunately. This is not what a human can do alone. This had to be done over years by the head, monitored over years to keep this away from humans, to get rid of this in the world immediately. The head departments have all contact information. Is not easy for a human to do because the phone numbers and emails to these head clinics are not listed. It is very difficult. I'm educated in these matters and choose to find these. And the pharmaceutical companies, clozapine and all the main antipsychotics that are pushed illegally and there and that don't have easy findable emails, contact information. Even when I found some contact information, these the buildings themselves don't have they don't list the real phone number. The emails don't work. A human has to know exactly where these companies, pharmaceutical companies, are and personally go there. This is not even easy to find. This is even medical staff is hard for to know, might know the actual places are, and can go there and help with this situation, to push this, to close this, but never do. The Prime Minister in Canada, this the President of the United States and the ones over the past years, when this all going on, didn't look into this. the ones that they employed, the members and the other staff that deal with these and human rights, they all have big news shows. They all walk around, make the paychecks, but their paychecks have to be represent a human on the earth, morally under God, to do right, to respect what they say is to respect human dignity, a valued human life, to make sure every human is health, proper care to live in their countries. In Canada, in the States, is mostly always cold, to get funding for humans to have heated houses, basic ones even, to disabled people, especially wronged by medical negligence, to find a disability, a place caring to help them recover their health, even especially a doctor wronged them, that they should look into the college and prevent from hiring these staff, medically negligent staff, psychiatrists. Every one of these are morally obligated under God to do their job and have all the resources to accomplish this, financial, all the contact information. They have all know what the officers below them, all the employees that they employ are morally obligated to employ proper ones that care for humans, the rights, especially Canada, in the States, Australia. They're all morally obligated, know what their job title is to do this. They run a huge country. Never do the job. Some care in some ways, the rest don't take the extra few seconds but have to do or they cannot make their paycheck. Under God, they cannot do. Make money when they're not doing exactly all what they have all powers in their job title description to do. To maintain a human's dignity, to have a warm home to live, at all times enough food and water. Every human right to have a normal human place to live, especially in a country that's cold, with heating enough, with enough nutritious food and water, a proper safe place to live, close schools by, and you have proper staff to employ, to have a to make sure everything is on God's morally right side, to check the online resources, to make sure the websites put intelligent information going on, nothing misinformation, especially medical, psychiatric matters. There's a research going on illegal. There's a human torture going on. This is not only mine in Toronto. I lived through it, and it's still going on. And they're all making paychecks at every level. The prime minister, the the president of the United States, then the other ones in each state, and then in Canada, every province employed under them. Some care do their job as they can, the other ones don't. They're not doing entirely or what they are morally obligated and have to do and have the actual resources to accomplish it. Then the other ones then are not employing the proper ones, some under them. Then the medical wards, then the buildings, then the mental health buildings, the schools, the churches. They're not closing the churches, temples, mosques during COVID as well. There's not, this whole world is beyond gone, not in order. 100 million lives of human, especially, this is beyond wrong. And I lived here and to learn in Canada. A human had to learn over the years what the Canadian government is about the Queen, the values, to respect. There's lots of nationalities here, different people. It's the land of opportunity. There's all these different people. There's a him and other people coming here from different countries to respect everyone, to get along. Humans to the every human will have the respect to have a job, to be treated with respect and dignity, no matter the race, the religion, everyone to get along in peace. Humans to have a job, a nice house to live, enough to even live in a safe place, nice schools, to maintain morally right standards. Most religious, even world leaders, religious or not, but are religious no educated on God's side, are morally obligated under God and Jesus do exist to do morally right, are judged right away. Every human, the Pope, they're not doing everything in their job title description power and have the resources and are morally obligated to accomplish this. Then they're not always looking into what the others employed below them have to. Then they're not looking into things, have the resources, have to do, are morally obligated under God to respect, accomplish this for all humans to be respected, for all humans to have proper medical care, proper psychiatric care, even the main in Canada, some countries, other ones to accomplish as well, help the other countries. When if funding, it is the millions of dollars easily there. Buildings, even new ones, even Camh made, but not help a human that was damaged wrong, they're illegally, medically assessed wrong, and then let go on the street, have no money from disability enough to live, and are sitting in the cold there every day begging for food. And not enough for a blanket, and not enough social workers could easily hire, contact few numbers, call to let the other stores even know what's going on. These patients there could easily donate a clothing, someone to help hire these staff that they even care. Not these 50 medically negligent doctors, psychiatrists made 400,000 to $1 million a year, have another job in the University of Toronto alone, other countries and states. This money all per year, a human they wronged or illegally most, damage the brain, and they cannot make these paychecks. They had to be taken away, but are not put in prison. These humans, and still working there, live in luxury while the humans suffer tortured. These humans live on the street. Cannot human choose the job, but can because of brain damage, the physical health damage. They beyond their control. This is what happened. They can't afford a medical lawyer to sue them to get money to live, and they live on the street and have to live that way, freezing to death. While there's a medical building that a Camh facility there has, could easily put these humans there, have empty rooms. I've been there. I've seen it's true. Legally put there, but I've seen there whole empty floors, new building, clean air. There's modern day technology there. The human well circulated air could go there, not live on the street, even wrong. They wrong them. Some hired at Camh to have the respect of human life to tell these people you can come inside here. It's warm here. You can stay here. We'll give you food. We'll give you all the water. We wronged you somehow. We the respect of your human life. You don't have a house because of this. Here's the empty rooms. Then here's a room. We'll find some clothing to donate. Take the few minutes. It's easy to do. Order a blanket. They have the covers already, the beds. Easily take the human, see on the street, walk there, say, look, here's the room. If you choose, come here, you can stay here, and a human will not suffer frostbite. That is already brain damage, shouldn't be in the cold. Because the doctors at Camh and the Mount Sinai Hospital morally disrespected a human life. While they have their vehicles warm enough, and it costs $1 million vehicle is true, all different ones, and they drive every day warm, plan their vacations, talk family nicely. I don't know how they live. They walk to they walk into the buildings in the morning. All the other staff, I don't know if they're going to know about this. They obviously have to know, but they're going along with this. They know they're working illegally there. What they did morally wrong. I'm against this entirely. They even smiled. I finally got out of that situation. And then they have the nerve, the doctor, to smile and talk to me, saying, did you come back here? I crying, don't ever want to see his face again. I would have put him in prison already years ago, but I don't have, as a stated lawyer, money to get a medical negligence lawyer. So assume what I could have made and harm my life and multi-million dollars that I could have made over the years myself. Couldn't, I lost university, the research, couldn't skate, I lost everything, couldn't play a piano, overdosed, wrong, didn't even need. And then him and have to live in cold homeless while they lived for 20 years on vacation for life, made the money, taught at university wrongly, made another paycheck, clinical head, still scientists there. Angelica Jacella have been on this earth all these years, and I'm telling the truth. I choose everyone in the world. Please help me. I made other videos. It's beyond I'm disabled because of it. What happened, but I choose this not to happen, rather to anyone. To prevent any human from being in this situation, for everyone to get rid of this term schizophrenia entirely to make sure when it's stated that everyone knows it is a general term. Put this beside this everywhere in the world. It is not a specific mental health concern name. Psychosis is a general term as well. Psychosis, NAS. These are not specified specific mental health brain concern disorders. There's no physical health symptoms, brain health mentioned in any of these specifically. There's a million people still wrongly admitted under these names and don't have any real mental health concern, and really definitely don't need any of these dangerous first generation, second generation antipsychotics, benzodiazepines, injected into humans most illegally, given these pills overdosed, and so the patient come and saying, "Oh, I need a lower dose." So the doctors have a patient, a client. Angelica Jacella. I have a list of these doctors to avoid. The Physicians and Surgeons of Ontario and the Nursing Ontario colleges that I filed as a complaints, as I stated. They're looking in, hopefully, but this is beyond wrong, as any human would hear this crying right away that know this, would want these humans to know that it was illegal, harmed a human and a woman, and put in prison. But they're unfortunately still working there. I have a list of these doctors, medical doctors, and psychiatrists to avoid at all costs, especially Dr. Agid. He is online, even stated most patients for years that he illegally pushed pills, illegally did research. He has journals that are not credible but are already published. He's wrongly affiliated with the University of Toronto, for over 20 years, or approximately. I was a wrong victim. Angelica Jacella and no others. This is a psychiatrist that barely knows English, is rude at times, is to be avoided at all times, is to be informed that the College of Physicians and Surgeons of Ontario, other humans pushed the issue too. I already put it there, but they didn't. Investigation's still underway apparently, but it's supposed to be done already. This human had to be in prison and never harm any life for approximately 20 years in Toronto. Worked at Camh, and he has the medically negligent, the caseworker with him, the nurse Rolando Vasquez. They all have encouraging words, some about them on their own, and all the rest of these doctors, psychiatrists from Camh mainly. And Mount Sinai still is unfortunate, and in the buildings, some of them. Keep in mind that some of these pictures of these doctors, psychiatrists, nurses that are saying they're doing great jobs in the community, they're doing great research, they're saving lives, they're helping the mental health of humans. This is all a big lie. These humans I dealt with, I am a victim of. A lot for many years. These are humans that are morally wrong. No, they did morally wrong, but did it to make a paycheck. And are all mostly all affiliated with the University of Toronto. I don't know how. And I've all published medical, mostly in psychiatric journals, in a well-known, credible journals, and PubMed listed easily. Found online, accessible to humans with misinformation, medical and psychiatric misinformation that has to be avoided by all medical staff, students of psychiatry, other students doing research, other medical staff, other researchers in the world. Please be cautious of these humans' journals These, I know the others educated, but I even myself read these, and these are not easy to read. Some don't even make sense. They are based a lot on human illegal research, even though they didn't state this. Legally done on patients, put on forms. These are medically negligent doctors. They have no respect for human life. They know to do, but morally look away and wrongly prescribe and misdiagnose patients. Mental health ones, what humans need, don't basically need exercise and proper advice and counseling and proper food diet recommendation and exercise recommended only. Even those with depression, recovering drug addicts, others with mental health, those kind of concerns, they state are mood disorders. These ones are humans basically need proper exercise and health and advice on this, some counseling, a healthy, happy life. These all know these medically negligent psychiatrists and doctors. Most at Camh, unfortunately, still working there. But they harm these humans, and most put on forms so they have a patient come once every 2 weeks and leave and write the next prescription. Illegal human torture. Most admitted against freedom of choice, disrespected human rights, patients, put illegally in wards beyond disgusting with no air circulated air enough. And the COVID times is beyond wrong was there. No human lived through, can't even go outside to prevent this spread, especially this in CAMH, mental health wards, long-term care facilities, other wards. There's many of them, women's wards, other different psychiatric wards, forensic units. These are humans don't have enough nutrients. I called once when I heard this about past that. I filed the complaints. No one follows up. A human has to push the issue follow up when they don't have a medical lawyer to sue the facilities themselves. They have multi-million dollars. They could easily help for put a human give a boost or some meal replacement when needed even. These are humans were not educated, and I haven't told others, but I knew about this. Need vitamins when on these antipsychotic supplements, nutritious food. They don't support it. A human has to basically beg for food in these facilities, for nutritious food, for supplements, and most are not educated, and harming this patient did for years, as I stated. This is disrespect of a human life. A human can work, brain damage, they're over sedated, the humans yelling because of brain damage. The patients, most these are the kind hearted humans of them all. Left alone there, suffering, knocked out cold, nothing to do, is beyond long hours. No enough social worker to help them to bring games, to do something, to promote proper health, for them to find housing, to get out of there immediately so they can live their lives and go out for air, whether it's respected to do, to go out even for air walks anytime they choose, anywhere they choose to go, free of choice, go to exercise more, do what they choose, go out, eat food where they choose. These humans are staying and kept in these mental wards, a lot against free of choice. Some don't even know what these forms are, not know English. They barely, these doctors, some don't inform them. Some already brain damaged and given these to stay there. And then they have nothing to do, no nutritious food. Some people have a bit more money, don't they give them food, but it's not, they even care at least, but it's not this ordered food. Humans need more nutrition, no fatty substance, no ordered fast foods. But these are the cameras I put there, and I even know the follow up after a human wronged is crying when they answer the phone, always beyond wrong. We'll look into this. And then in the second months, weeks go by, human call, or did as soon as can, did they follow up? Did they do something? Did you put nutritious food for these people? Oh, we're looking into this. Maybe something a bit got accomplished this. And then they follow up and then nothing. But the people suffering is long hours. These people are well fed working there, is their job. The whole department's head trustees make hundred thousands of dollars, $2 million a year. Have other jobs, head of departments. They all have pictures smiling on the CAMH website, most illegally working there. They all wronged the human life or more for over 20 years, some less. These the head department heads, the trustees. They have the nursing staff, huge pictures, posters that cost more. There's many dollars to make a picture like this, plastic covered on a wall for a medically negligent nursing staff. They're saying they're doing great work in the community in Camh. This is the best center for addiction and mental health. This human I was working with me didn't help me even to give me some food when I needed, a glass of water when needed, and a human lying there with the side effects of medication told don't need and legally mistreated me as a patient. And a smiling every day went and those did morally wrong and made the paycheck and has a picture there and a lot of staff there on the buildings that they pay money but don't help to give food to these and they're legally keeping patients their harm need more supplements that they can possibly have enough to help lessen the side effects. When given clozapine, olanzapine, a human needs a lot of vitamins and nutritious food for the brain alone to function physically. When on these dangerous antipsychotics, these humans need a lot of nutritious food to be monitored, to help the nursing staff, to help them remind them that humans are brain damaged. Most don't care. They oversedate them, put some antipsychotic that damage them, put asleep for 12 hours and leave. Then I don't say, oh, you need B12 in the morning, not at night, to help with reduce the side effects. These reduce drooling. This lower the medication. You don't need to sleep 12 hours, knocked out cold, over sedated. To recommend the vitamin C throughout the day, B vitamins. Eat some healthy nuts, walnuts, almonds. Certain even these are not expensive. Little ones throughout the day are healthy snacks. These are they could easily given to these patients, have proteins, amino acids, help the brain. There's a vitamin D, take them when it's possible, even though it's COVID, but safe to do. Go out in the sun, sit out for air. Find other patients they like to help bring joy to their life to talk to. But at this distance, I guess, with COVID going on, safe distance even. They're not doing anything didn't do anything to promote the well-being health of a patient. Hundreds of patients in Camh for over 20, now it's almost 24 years that I know of, and other people were there before I got there. And I had to deal in the thought so I don't even be in the buildings. A human cannot live in those buildings and do nothing and have no food, nutritious, and no money basically from disability funding, ODSP, and cannot have no joy to go buy out some lady or nice purse or sweater. There's not even enough for clothing. Humans wear the same clothing that the ones they have, rely on donations. No one knows about them, so they don't have donations. These are humankind out of them all. They're wrongly harmed, most of them. Their brains damaged and cannot barely think, and no one to help them. People, the staff, wait, I'm on break. These always on break. The registered nurses especially. This is beyond wrong. Humans begging for food when they need nutrients care the most. Their brain damaged. The heart is damaged. The nervous system some damaged because the medically negligent staff wrongly. They even inject human and muscle illegally and have security standing there to make sure that they're given this and they don't some act up, some humans but right to defend themselves and say, look, I don't need this. I don't want bilateral tremor symptoms injected with something here, a dangerous antipsychotic or something else, and make my whole nervous system, my physicality, muscles react shaking, my muscles spasm, my brain damaged. If a human complain, most know to do and right to do, but don't because they call security, code white. And I still even talk to certain people there, working there every 5 seconds, code white. Because the medically negligent staff are working there and they're wrongly giving prescriptions to these patients, and the patients are the right to speak the truth, to be respected as humans and say, I don't need this. But as soon as they say something, they start yelling or something and right to tell the doctor straight the truth. They don't need this. I don't want this antipsychotic. I don't need ECT. Then they call code white. This is and then the security show up or the police. But these doctors, I know they're still working there. and then they walk away. And a patient is left question their security, did nothing wrong, have the right to defend themselves, their perspective, right? To tell this doctor, you're pretending you're harming my life. I don't want to live through this. But this is beyond wrong. And please, anyone who knows this, put a stop to this. I pay the $30,000. I do the job, but I have no job. I disabled to pay for medical negligence lawyer. So I have money to live, what I could have made, and take away the paycheck license of these medically negligent doctors, psychiatrists, to make sure they're not the professors and I care for health at the University of Toronto, any other university they're affiliated with, any other brain centers, any research centers. These are still working there. These are Dr. Agid, and the other ones, main ones, are stated to be the head or clinical scientists, researchers. These are well-known doctors. I went the other time, and they're stating that he's well-known. He's a very busy man. These doctors already have many patients, and I cannot be working there. Already wronged for them illegally most for years, and should be in prison. And I'm even started crying when I hear that there's still even answering machine there trying to follow up personally. If the college even called them, contact to see about the investigation that I filed a complaint, which is supposed to be done already, but I didn't get the results yet, and it's been over a year. And these humans still work there over a year, making $100,000, over $200,000 to $1 million a year, drove in their warm vehicles. The whole year is a very long time, while the patients potentially wrong those. And I have no home all that year. I have no can do a job. I brain damaged because of what they did to me, and I was wronged by certain ones for almost 20 years. And they're walking around on vacation and still working there, potentially harming other patients, making what their paycheck cannot be. The college knows. The College of Physicians and Surgeons of Ontario, they know that they have to take away their license. I informed them, they didn't do it yet. These other doctors, this other one I'm cautioning everyone to avoid. This is Dr. Daniel Blumberger. This was a head rather. He was working in a department head of the ECT clinic at Camh years ago, and is still after approximately 4 years. He's still working there, but moved to another department and working at the Temerty brain center having to do with Camh in downtown Toronto. And he's a medically negligent medical doctor. He wrongly signed prescriptions enforced against my freedom of choice, collaborated with Dr. Agid and a Dr. Kniatskaya. These are psychiatrists that illegally wronged me over time and forced to go through ECT. And the other staff that are still working there from the ECT clinic that closed down Camh but is now then moved to the Temerty facility there. The brain facility has the electroconvulsive therapy and other brain procedures they're done already is almost over 4 years by now. They are still working there. The Dr. Daniel Blumberger, he is supposed to be in prison and his doctor's paycheck taken away and be not a board, the head member or the chair, depending on what department he's in. And already for approximately 4 years in prison for illegal human torture charges, and have his paycheck taken away. And I could have sued, but I had no money for a medical negligence lawyer. And he potentially had other patients there and wronging them, are going through is under in the employment, and then this department employed these physiologists, the nurses, registered nurses, secretaries in this department, ECT clinic previously. There's a Temerty, the brain department there at a Camh in Toronto currently, employed. Some probably even for this 4 years, which all should be in prison as well. Charged for illegal human torture, bodily harm against thrill of choice. They knew morally to the right to make sure I didn't need to go there to find every way possible what I chose and had to be respected my brain and physical than a woman, so that I didn't need to go through ECT, electroconvulsive therapy. It's not therapy ever. It is illegal human torture against thrill of choice. And their paychecks with their jobs, the psychiatrists, the neurobiologists working there, that this Dr. Bloomberger knows. And he even signed the papers for this illegal torture I didn't need at all. They always were there rather, stating I'm doing fantastic, but signed the prescription. Illegally forced me, a woman, no children, didn't want brain memory damage in half, and knocked out cold, and have my brain electrocuted over 10 times a year. And this one's still smiling. The Dr. Bloomberger, please Camh, get rid of, update your website and all buildings and take down every medically negligent doctor, psychiatrist picture that's smiling there, and all their names and put them in prison. Take away their paychecks immediately. They've been working some for 20 years. You know who they are. These medically negligent doctors, psychiatrists wrongly, illegally did research on patients. They wrongly put these results in journals in the University of Toronto are affiliated professors well known, associate professors, clinical researchers, clinical scientists. You have them employed still. You're doing morally wrong under God. You cannot make your paycheck employing them. You have to fire them. You were supposed to for over 20 years, some of them. In the past years, they are still all have their numbers working there. They have secretaries working with them, case managers. You did not fire these humans. There's many humans, patients wrongly wronged by these certain few doctors for over 20 years. Dr. Agid has to be fired. Was supposed to and wronged illegally over for approximately 20 years, my life. Endangered and harmed the brain, mind, and I'm on a job because of it, no children. And he wronged other humans' lives, I know. And he has his picture still smiling on your website, on the website Camh. The phone number contact still there. He still has as many jobs there, ever well known. The other medically negligent staff going along with him for years, wrongly prescribing, misdiagnosing, giving wrong second opinions to innocent humans that don't even need any dangerous antipsychotics, don't need ECT. There's the other doctors. There's the Dr. Agarwal, Sri Mahavir Agarwal, working in Camh emergency, wrongly admitted me many times. Easily could let me go assessed properly medical, didn't, put on the forms. This doctor is still working there, unfortunately. Camh emergency, please avoid him at all costs when proper. He should be in prison. He endangered and wrong disrespected my life, my health, and a woman. I brain damaged because of it. Mental health damage, organs damaged, I didn't need at all, illegally done to me. He makes the $1 million while I on vacation and couldn't do his morally obligated under God not to make that paycheck if he harmed my health, but it's still after the college I filed complaints and it's still after a year. They said to be done already investigation, would be in prison, is not, is still work there for over a year. If I had money for medical negligence lawyer, I would sue him, easily win, and he'd be in prison. And then something right, proper result from this, and other potentially, I know, other humans' lives not wrong by this medically negligent doctor and who is rude, and to a lady. Disrespected human my rights, my choice, and many other staff at Camh emergency and this Camh and Mount Sinai Hospital. Unfortunately, it's disheartening to see and hear that they're still working there and over the year made $1 million paycheck, lived their life in luxury, had a warm and home, talked to their family, have children. Well, I don't. And it choose and had to be in prison and wrong potentially others this whole year. And couldn't make their paycheck because they wronged a human life, mine, and deserve to be in prison all these years. But are still working there. Other doctors, I'm going to state, because there's something have to be done. So for the human considerate human of others, this is as a caution for humans to find these doctors to avoid them at all costs. Make sure they don't have another client to potentially wrong their health. Well, they're morally supposed to do right, help health, but are not. And if anyone can find a way to file complaints as much possible, inform humans online on complaint websites about doctors, psychiatrists, nurses. The human has to act. There's some humans don't know about it, inform them. And please put a stop to these doctors. They already made millions while humans suffered. These are not what their paychecks. Keep in mind, boards, doctors, psychiatrists, nurses swore oath to God they cannot make a paycheck if they harm a human health. They have to have it taken away by the college and employers immediately, and they have to be put in prison. These other doctors, the Dr. Nazrim Adams, Dr. Maris Aga, Dr. Sabrina Agni Hauti, Dr. Zahra Ali, Dr. Naha Al-Shamari has worked in Camh for years. Dr. Luke Bears, Dr. as a stated Daniel Bloomberger, this human has to be put in prison. Avoid him at all costs. Do not go to the ECT department. Avoid it. Save your health, save your life. Potential patients, other doctors, don't associate with him and these other doctors, medically negligent psychiatrists. Do the right thing. Help human lives, health. File secret complaints if needed. Get rid of these humans working there. The College of Physicians and Surgeons Ontario clearly it doesn't have a respect of human life that they're supposed to, and their job title describes have to under oath under God to hire proper medical staff and to maintain to monitor if they're doing it properly, to take away their paycheck if they're not, if they're harming human health or disrespecting lives or patient rights in any way, putting illegally on forms. They did not. They haven't done for years. It's over 20 years. There's the other doctors, Dr. Benjamin Cassidy, Dr. Gregory Chandler, Dr. Mary Ellen Ferguson, Dr. Natasha Fernandez, Dr. George Fusius, Dr. Cedric Gabelando, Dr. Amy Gajara, Dr. Justin Jaja. Avoid this doctor at all costs. This doctor has worked over 20 years approximately, in Camh, the Center for Addiction and Mental Health. This doctor wrongly prescribed antipsychotics dangerous to me, put in mental wards, and a rude didn't treat me with respect. A woman, an intelligent human, fought for my life to get away from these wards. He wrongly, and then when I didn't need at all, prescribed the ACT. And forced to take illegally when I don't even have blood in veins, heartless human knows not to do. And when I sought a second opinion, he disrespected this. He did this, and I've been in the ward, and he's already that other building closed down, but is still working there in Camh illegally. I had no money to sue and would win, and he put in prison, and I could rest that he's in prison, not harming anyone potentially else, and he wronged my life. I have no children because of it. I have severely brain damage. I even lived through what no human lived through. A woman and put these in these wards no human see. And I have no money, no home, as I stated, because of him and other ones. And he still wrongly have contact recently number to find out what's going on if the college contacted him with my complaint. And is still working there. All the names of these doctors I'm stating are on the Camh website still, and they are still employed there and in Mount Sinai Hospital. These are the main head doctors, most and psychiatrists mainly, well known throughout these hospitals, mental hospitals, psychiatric parts wards, for many, many years, and unfortunately still working there after endangered and harmed my human life and should be in prison. Their paychecks taken away and are not. And other medically negligent staff know and are going along with these and show up smiling every day. I don't know how they live. They harmed human lives and still going making money going on vacation with their luxury vehicles. They don't put the effort, they have people to put money there for the wars to help these humans is beyond illegal human torture. Is a disrespect of a human life, but not even recommend the proper nutrients in it. And they're the head ones. These are the head doctors, psychiatrists, and affiliated with University of Toronto mainly and other ones. Need to be stopped. They need to be put in prison. They are torturers. It is illegal what they did. They continue to make paychecks, and most of the patients wronged, and the ones that they did couldn't do and is illegal. I didn't even need to be there at all. Don't even put a real name, put schizophrenia as I stated, and that's not even a real mental concern name. The other doctors, Dr. Goodmorphy, Matthew, Dr. Zaid Gazala, Dr. Ariel Graf, Dr. Margaret Hahn. She's worked at Camh for years. She's to be avoided. All these doctors to be avoided. Please keep in mind, please someone help me do something. Put them in prison, take away their paycheck. Help file complaints as much as needed. Put names, put comments of other patients as needed. Doctors, avoid these doctors on their websites. Put an effort to take down their smiling pictures. A human crying patient wronged by them illegally doesn't want to see them smiling and have praises put them that they're doing great in community there when they're not. They're harming human lives illegally, doing research against human freedom of choice, pushing pills. The other doctors, Dr. Jason Johannu, Dr. Pamela Kaduri, Dr. Anita Kang, Dr. Amar Kane Allah, Dr. Lisa Klotz, Dr. Yulia Knatskaya, please avoid her, psychiatrist at Camh. She wrongly prescribed ECT and went along with other psychiatrists. These humans know we're doing morally wrong, but continued over 10 times a year wrongly prescribed and forced me to go through brain electrocution, essentially. I had severe memory damage, homeless because of it. And she unfortunately is still working there at Camh, potentially in the brain Temerty department now. And other medically negligent staff know about her and still go along with it. Her misdiagnosis of patients, she endangered my life and harmed illegally. Human torture, should be in prison for over 4 years already by now and is not. And made the $1 million swore to God to help human health, but is not. And other humans suffered, was there, she was present. And these other humans didn't need any ECT. And have brain damage, harm for life, and homeless, not enough money to live off disability. While she went on vacation with luxury vehicles and still living her healthy life. And the college didn't fire her yet. And supposed to right away. Dr. Paul Kurdiak, Dr. Laura Lachance, Dr. Renee Logan, Dr. Andrew Lustig, Dr. Marina Mamolotti, Dr. Karen Eng, Dr. Elena Nika Graham, Dr. Mary Praisman, Dr. Ajmal Razmi, Dr. Jesse Remington, Dr. Kevin Rohani, Dr. Louisa Shan, Dr. Adam Tasca, Dr. Chase Thompson, Dr. Bogdan Christian Ulick, Mount Sinai Hospital, to be avoided at all costs unless treated properly, but he wronged my life, should be in prison for years. Dr. Sean Vazdev, avoid at all costs, might have a private practice. He should be in prison for years and is not. Medical license taken away. He wrongly, illegally harmed my life. Dr. Sonia Vukovic, Dr. Tessa Wilson Ewig, Dr. Zhu Hyang Yoon, Dr. Juveria Zahir. This is the main list of these head medically negligent doctors, psychiatrists that everyone knows is working either at Camh and for many years, over 20 years, and at Mount Sinai Hospital in Toronto. And unfortunately, all still working there. And unfortunately, I don't want to think of if they harmed and wrong, but I've seen other patients they did illegally, didn't need any antipsychotics or ECT, and are poor, disabled because of it, and no home to live in Canada cold while they live in luxury with their $1 million vehicles, even heated that way, and still working there, downtown, have the nerve to smile while talking to patients they wronged. This is beyond wrong, and humans, patients crying see these people, and some still in this place. It's not easy to get out when in there unless have a lawyer. And to educate the patients there, to let everyone, so that's why I tell everyone, please educate yourself. If you have a mental health concern, real true symptoms, please consult a family practitioner or someone that you know or you trust, that you think knows, cares about your mental health. Make sure to assess it properly, to find a nutrition first that they recommend, proper exercise, proper counseling first. Make sure they don't put you under schizophrenia or psychosis or NOS, psychosis, mania. These are general terms. This is not a real mental health disorder. It's not a brain health problem or with any specific symptoms. Avoid mental health facilities at all costs unless you know is a proper one for you and you choose to go there by free will of choice, not wrongly put on form. Avoid this. Always take the time, unless emergency, obviously go to a medical hospital. Avoid Camh emergency at all costs unless needed to go there. There's many medically negligent staff, and the ones if they put on form wrongly assessed to make paycheck, you might be there for 3 days on a form and don't have to be there till you get a doctor push the issue to get a blood test or something to help you to assess easily, could have been done already and let you go. And if you're put there illegally and kept there, it's not easy to get out. You need a lawyer, and most people don't have money for a lawyer. And the nursing staff, the registered nurses, and the other nurses, and these all nurses, I have a whole list of these too. 50 to 100 nurses and registered nurses in Toronto, in Ontario, Canada, in Camh, most still working there. Some work there illegally, wronged beyond many patients over the years, disrespected them, went along wrongly with misdiagnoses one after another, especially of schizophrenia, catatonic. All these patients didn't have at all. And the doctors wrongly put them on forms and forced these humans went along, and humans patients fought with them, mentioning their right perspective. They didn't have to be there, begged for food for them, to help them proper timing. They most of the time stated that they're on break. I can't help you. And they're illegally still working there and cannot make their paycheck all the years because they morally did wrong not to human health. And they're still working there, some after almost 24 years. And even despite the college nurses of Ontario, all I can do when I can't afford a lawyer be sue and get money and put them in prison so they even stop practicing and should be behind bars. They went along and harm human, disrespect life and health. Take away their license, be put in remedial studies entirely, take away their nursing practice, job title. They didn't, they swore the oath to God to help human health, didn't in any way. They smiling came and went, and the humans crying see them, and they're most of them old by now. Some mention things to patients don't want to hear, and the patients crying to ask them for help, and they don't even help them. And they're still working there. It's true. I don't want to see. I've seen it all. And I'm only a human. These are medical staff and board members. I need the colleges to do their part. They're morally obligated to hire and to fire these people if they're not doing right under God. They're not human helping their health. They're illegally torturing humans. This has been going on for over 24 years. A human can't even contact the doctor, and then a secretary, you have to contact the college who is running the investigation. I have a right to speak to the doctor that wronged me, put me to talk to him in appointments and endangered my life, and I have no children because of and illegally harmed my brain, wrongly prescribing antipsychotic ECT I didn't even need. And to tell them the truth, but they don't call me back. I have to call the college. Then they let me know how the investigation's going, which they barely do. Some call back right away, but then a week second go by, human has to follow up. They don't do anything. This is their job. They're making paychecks. Human patients suffering. This is a human. These people is a common sense that these have to be stopped. These doctors be heard right away, and the college would call them and say, "Look, you're going to prison." Put the police come there after look at the file. Easily done, and right away put behind bars. Take away their paycheck and give it to someone, a doctor that will help human health. That's what the paycheck is for. To help human health. To help assign someone who cares. So Camh and Mount Sinai, anyone who knows, please help this. The board members, they all have moral obligation to make sure these doctors don't work there no more. Fire them. I listed them. This is 50 of them. These main ones, they're all well known. They shouldn't be working there for years, and they all know. And there's case managers. These are nursing staff and other ones. They work to go along and help like a secretary doing the case study. The case managers manage the files of these doctors, go along, went with them. There's over 100 of these working there at Camh wrongly went along to make a paycheck. They know the patient's harm health and still went along with this. And the patient said, "Look, I don't need the treatment. Doctor's doing wrong." No, treatment. Doctor prescribed it. It's not treatment. It's torture. No, it's a treatment. It's true. That's what I hear. This is what they tell all the patients. There's wrongly people still living there, and most against free will of choice, not informed. The medication not monitored. Go outside. The begging for food because there's not enough food. The doctor's prescribing to make sure nutritionists pay there to the least care. Those ones, nutritionists, some social workers, but not employed enough. They don't have the actual then resources given to them. The empty building, as I stated, this is millions of dollars. This is a lot of money. They could have paid a few dollars and buy some walnuts. B vitamins already the pharmacy is provided to give the patients this. They haven't done. I've known one human and told him and crying after, but I'm educated, told him that he was there for 10 years and a doctor over sedated, gave him clozapine he didn't even need. And for 10 long years was there, not given B vitamins, even recommended, would help his brain. Omega-3s help the heart brain, vitamin C, vitamin D, not told, not to smoke while on clozapine. And to be better off if he just to have a low dose, or this not to have it at all. He didn't need at all. And I helped him better I could, but does it need other humans to help these people there? And some are not educated, don't know English. They're wrongly admitted. No one to help them. Then obviously the staff nurses, some care there now, but the other ones don't. And these don't know that him and I'm intelligent. Or you have to tell them, tell the nursing staff, when a doctor tells you that a prescription is wrote and it's gonna come back in 2 weeks, then tell them, if you feel worse or better, say, I need to see you tomorrow. The doctor, tell the nurse, I need to lower the medication. I feel better. Get rid of this. They have to push the issue. They tell the nursing staff. A lot of patients don't even know. They presume all the doctor said, okay, they're coming in 2 weeks. They knocked out cold for 2 weeks, sleeping over, sedated, then get up, have no nutritious food, wait till the doctor. This is not how it works. These are women have a life there. They right to have most want a job, a family. They're wrongly given this clozapine, olanzapine, risperidone, polyperidone, Abilify, aripiprazole. This really damages the brain. Think I already lived through. And this patient is still living there with not enough food, not enough nutrients. Even after I filed complaint for many years, over months, I lived through this. I filed the complaint type. Would I even suffer 20 years of these people? The main ones know that they would really look into this. The facility itself, Camh emergency, and they barely did anything. The human is still there, and the human barely told over time would have to remind and others to learn about this. That's why I made this video, the clozapine meal plan, to let patients know about some basic information to avoid clozapine, but have taken what the vitamins needed, so that the doctors didn't tell them to recommend. That help a lot with the brain, mental, physical health, reduce side effects a lot. Angelica Jukela, I put another medical negligence video to help other humans. I'm telling specific information here. Something has to be done. I even put the names. Someone has to do something. I don't mention names as needed, but I know I'm intelligent human, but someone has to stop these people. They're doing illegal research. These are humans are treated worse than lab rats. These have been over is 100 million days nights for over 24 years. Most of them working there in Camh for these long to over 2 decades, harmed human life. Made the $1 million on vacation, cars they're driving, still do. And people suffering their patients there that they wronged, cannot do, and have no money. Disability is nothing. No one looking into this. There's no housing. Human those on waiting lists to harm the brain, even illegally. They need housing to live when they get out of there. Is a 10-year waiting list. I human this and it might live with someone that's disabled or this to find the other housing as well. This is not enough. There's no funding and barely anything at all. Is beyond disgraceful for a human that was even wrong. But these people making $1 million, doctors, and then go live on the street have to, and wait for housing maybe 10 years, but freezing for 10 years, don't have no home, begging for food even while in these facilities when they have these big ones there. Empty rooms above Camh emergency in Toronto. Pictures paying $1 million, as I stated, for these praise these medically negligent doctors, psychiatrists on the websites. University of Toronto has these doctors, professors not looking into this either. This is a well-known school. I was there. It's a nice school, but they have to do their job. They have to fire their staff, hire the proper ones that care for their students' intellectual well-being, to teach them morally right. For them, they didn't do the doctors themselves, psychiatrists do morally right. They did illegal human torture research, and they wrote papers misinforming students. They had to be already gone, non-practicing. Their professor, associate professor, researchers, head lecturers are all listed at U of T website in the Department of Psychiatry and are still working there for years, some over 24 years, illegally misinformed the The students, they're teaching them. I wouldn't deal with any of these humans. They don't look humans in the eye. They know they're morally doing wrong and made $1 million and harmed human life and need to be put in prison and taken off the payroll. At the University of Toronto and other universities, this Temerty, rather, this owner of this company, they made this huge new building is making at U of T, the Brain Center. These, please know that there's are medically negligent doctors and psychiatrists that are employed there that have worked already in other places, and most in Camh, the Center for Addiction and Mental Health, Camh Emergency, Mount Sinai Hospital, other ones that I know. There's already a list I put there that I stated, and other ones. These other colleges in the other the employed staff members in the nurses, physiologists, all different medical fields, secretaries, pharmacists. These all they're still working and legally went along with misdiagnoses and prescriptions and enforced illegally patients to take dangerous antipsychotics and ECT for over 24 years. Some are employed still in the new Temetry, different departments, buildings. There's a Dr. Bloomberger, Daniel Bloomberger, in the Temetry Brain Department at Camh. There's whoever the owner of this Temetry is, you're morally obligated under God, and most are medical buildings and facilities that you are overlooking and hiring employees in. You have to do your job or you cannot make your paycheck. You have to do your job and look into these and fire these humans that illegally tortured me and other humans in the many different fields, not only the medical doctors or psychiatrists, and fire them immediately. Give the paycheck to someone who cares about human health and life. That's what the paychecks are for. They cannot make paychecks when they harm human health. And save this money and give it then to a human, put food into these Camh facilities and give to patients to care for the health and find proper housing for them. Invest this instead of 400,000 rather $2 million a year to give to a medically negligent human torture, a doctor or psychiatrist that harm and doing illegal research on patients that is not even proper English done and documented in medical journals. That is misinformation. And there's some doctors, as I stated, worked even 4 years past when I would sue them and put in prison and wouldn't be working for 4 years. And the company would save $1 million and potentially other people wouldn't be harmed and could use this money to give food, shelter to those in these mental health hospitals to build a better, make better life quality for their patients. The ones that were wrong, like me, to help me. They employed wrongly medical doctors, psychiatrists that I even didn't choose even deal with, and they were not is their job too. They're morally obligated to find proper doctors, psychiatrists that will treat me with respect, that would care for my health, a woman, to make sure don't wrongly prescribe me dangerous antipsychotics one after another, an ECT I didn't need. I am crippled because of it, lost university degree, memory damage, thinking ability damage, couldn't have children approximately 20 years, couldn't figure skate what I learned as a child, work hard to do, pay off university, lost driver's license. And at these department heads, the Camh emergency, the facility who owners as well are morally obligated to check on these and fire them. The employees, if they don't, they're illegally leading to humans being tortured, like myself, hired staff medically negligent and cannot do their job and have to be put in prison. They cannot make their paycheck. Every human is sent by God, and Jesus cannot sin against another human life and disrespect it in these job titles that have respect have to the humans working under them care for human health. If they don't employ proper doctors and psychiatrists, nurses, pharmacists, they cannot make their paycheck. They have to stop their job immediately and never make that paycheck because they're gonna do wrong to disrespect human health, human dignity, disrespect it, free will of choice, human rights, patient rights, If I hire a doctor that does this, and they're morally obligated to make sure the doctor doesn't be hired there. And if these board members keep going there one after another years hiring and they're still working, never looked into these employees that harm million patients that are still working there and have made paychecks illegally and morally are judged by God doing wrong. Couldn't make these paychecks, could have had to hire someone that it would care and do the proper job, has the resources and financial use that money to help human health, but didn't do these the wrong didn't have to have to hire staff that care. The trustees, the board members. There's 100 departments in Camh alone. There's a woman's ward, psychiatric wards. There's a forensic unit. There's some different brain specialist units. There's 100 million different ward specialties, research facilities. There's in the Camh alone. A lot of have illegal staff who harm human patients for over 24 years, should have been in prison and harmed many lives, and they're all poor and living on the street with with a disability, not enough to even buy a jacket, and while live there have poor quality of life, never provided the bare necessities of life, never provided a happy life there, never give them clothing, gifts proper, never give them any enough food, nutritious, no supplements enough recommended to patients, hundreds for over 24 years. This facility is the some that care, but the rest, hundreds didn't. Million lives suffered while they went on vacation, those that wronged them. Psychiatrists, doctors, nursing staff, pharmacists, physiologists, neurobiologists, specialists, researchers, clinical scientists, unfortunately still work there, made millions of dollars, as affiliated with universities, another job, and made millions of dollars. They had a happy life all the years with the families, the wives, the husbands, the children. They even tell the children wives where they got the money, what they did? They right to know. They illegally harmed human lives, made me ill and damaged my brain over many times a year. Clause been 20 years, then don't need it all an ECT over 10 times a year, and still illegally worked there, made millions of dollars. And I gave money to the families and the children, and went on vacation, warm homes and everything. Well, I am homeless, and I could have had my career and actually cared and did research and saved lives for years, but couldn't because they wronged my life and health, and still working there, and I have no money to sue and get rid of them. And disability is almost nothing. And so I choose anyone who has the resources and these high level jobs, prime ministers, the Pope, look into this. These are high level jobs, world leaders, the president, morally obligated. Keep in mind, God judges everyone human right away. Respect Jesus, cannot sin, do morally wrong. Hire the proper employees. You have the resources. Is your job to do. If you can't, then find someone who does. Is there can only make a paycheck when you morally do right and do your job description to help respect the dignity of humans, patients, the lives of every human to be respected, to have proper homes, warm, safe place to live, a place, a country with and have people coming, immigrants to screen properly, doctors, psychiatrists, medical staff to know proper English to make sure they're trained, that they have intent of helping humans, to only let people in that care for, they respect the human dignity of others, to look into this as best you can, hire other staff. You have the resources and morally obligate under God to do, or you can't do your job. And then the staff under them in different provinces, in the states, in other countries, in the cities, in the managers of different medical facilities. There's researchers doing illegal researchers in the world, research illegal rather, even on COVID, on patients. There's other ones creating beyond wrong, unethical versions of coronavirus that, if spread, would harm millions of lives and wouldn't be stopped. These are not looked into, unfortunately, by 100 million high level humans morally obligated and have the resources and take a second, easy have to act now. Fix this after all the years. Many lives were lost, many humans suffer because the high-level jobs made the paychecks but didn't do everything in their job description and are told when they're hired to do right or can make their paycheck. Do right under God, respect human dignity, rights, make a safe place for everyone to live, for their health to be proper, their lives to be respected, valued as every human right to be, and all living creatures, everyone to have a proper home, food, nutritious food, everyone to have proper medical care, everyone to have proper doctors, psychiatrists, nursing staff, people that care, monitored, humans to actually do their job, stop being lazy. Don't make a paycheck if you're not going to help someone, especially in these job titles that have to be help human health right away, to care for their lives, patients. They affect other lives of people. Some people are parents, some have children, humans have pets, these affect the lives of other humans. Everyone has to be respect the dignity of God in them, to respect the other ones, hire in their job positions what they're trained to do, then train and hire other staff that care. Then under them have staff that have to hire other ones that care. If the high level heads, the Pope, the president, the prime minister don't start at the head to hire proper staff that will hire other staff below them and won't do their morally right, then the whole world is run not in order, and many humans suffer needlessly, and this is beyond wrong, is not allowable. And that's unfortunately what happened for many years. So everyone, stop thinking about your paycheck. If you're gonna hire those humans that would easily and want the job and need money to live, obviously, and actually care and will do the job. Take the time, act right away, do everything. They have more resource, all the resources, contact information, all the departments under them. They would hire proper caring humans, doctors, psychiatrists, get proper department heads, medical facilities, close the ones that are done wrong, help fund the other ones, focus on human life, more important. Humans' basic needs to live is food, shelter, nutritious food. Get rid of, stop making money. Close all the pharmaceutical companies with the dangerous antipsychotics. They are never a cure. They endanger human brain and harm the health more over time. Clozapine especially had to be got rid of from the world years already. ECT is not ECT is electroconvulsive therapy, is not therapy. This is beyond wrong. This is human torture when against freedom of choice. These are all medical clinics, even the doctors smiling online. All the head departments, please fix this. Prime Minister, the President of the United States. There's even kinder than you, so even please take this second. You have the resources. Please look into this. Other departments are not doing their job. Make sure they hire people. Make sure they hire doctors, psychiatrists. Look into it. If it takes a second to make a phone call, you have the resources. I don't have contact numbers, and not one human being can do, but you can. You have the job description that you're morally obligated to do. And one phone call to look in will save lives of potential patients. If you get rid of one of even the doctors, all of these have to get rid of immediately. They worked there too long. They made people suffer, and while they went on vacation, this money illegally under God cannot do. These humans, the patients still wrong, need to be helped immediately. They were disrespected, some, as I stated, 10 to 20 years with not enough food. The same basic clothes, jacket, and cold cannot go outside, not even a jacket. You damage, no one to give one. The disability in Ontario money is beyond worthless, nothing. A human can't even buy a bit of food, maybe last a week, and a human have to live off that for a whole month. Can't afford rent, can't afford anything, can't save money throughout the years. They're already disabled. It doesn't mean they can't work. They have a brain disability of a brain or physical injury that prevents them from making money to work. They have to be respected in a warm, safe, healthy place. They don't have a house in Canada. It's cold, freezing to death, and starve to death and die. And they have brain injuries, need to be cared, respected as humans. And in Canada and the States, this is going on. And these doctors accomplishing this in legal torture, wrongly prescribing antipsychotics, and these humans suffer, don't need, and live up on the street with no money, disability, because the government's not giving money, no funding to the Ontario ODSP. But these humans, even like myself, were wronged, would have the right to live when they can afford a medical negligence lawyer to sue them, to put them in prison. They wronged my life for 20 years. It's beyond my control because they didn't. The head office they didn't hire the proper medical staff. Then the higher level, the prime minister didn't look into the country to make sure the borders they don't cross these illegal immigrants or who knows where they came from that don't even speak proper English, and it's true. And they are working at the Camh in main facilities in Toronto, psychiatrists for years, and teaching at U of T. These are well-known U of T and is in Toronto, like Harvard in the States. These are well-known. These are high-level humans that choose and study, invest money and time, and when they learn, choose be professors and care to inform and teach the proper information to other students, especially in medical field. Involve human health, careful thought, a lot of studies. These when they have a medical doctor or psychiatrist wrongly working there and misinforming students, and they're reading these papers that don't even make sense, and but it might be misinformed and will potentially wrong another human life by accident. A human brain health, mental health might prescribe something wrong because these doctors wrongly misinform people and publish journals. And though they're illegal research and didn't put the right information in it. So this has to be stopped. There has to be something done on Earth immediately. I'm only one human, so please share this video. Might be a bit lengthy, but this is at least true valuable information that will save the health and lives of hundreds of millions of innocent people, even currently taking illegally clozapine, especially olanzapine, risperidone, polyperidone, and electroconvulsive therapy given. These are Angelica entirely against them all. I am a human, morally right on God's side. I am a human earth angel from experience and a human into medical lab research and have degree in life sciences. Angelica care for the health of all humanity, so please take action. Those with the resources, high-level jobs, each department, look into who you're hiring. You know that's your job to hire proper caring staff. Respect human dignity. If you don't, give your paycheck to someone else. That's what the job is for, to help human health. So give it to someone. And job title, who does will do that because you're these jobs who you hire, these people affect the other humans employed below them. And if you're not doing hiring proper people, those humans aren't doing their job right. And 100 potentially million people health lives are in danger and suffering needlessly, and you can make you're morally doing wrong and punished for it by God. Is not no one gets away with this. These this is the way things are, the truth. So please, everyone, fix, especially Camh, Mount Sinai Hospital, Toronto, Ontario, Canada, immediately. This had to be done for years. Care for human life and health. Help humans be happy. That's what the main thing is. Respect human dignity. A human life to be, that means valued, is valued. Dignity within them of God to be respected as every human life to be. As they choose as well. Care for the health. Stop thinking of your paychecks. If you're gonna think a paycheck to do wrong with it, don't make your paycheck. Don't do that job. Give it to someone who that job will do properly and care for human life and health. Respect human dignity. Other lives are affected. Do the right thing. If you're medically negligent, doctor, I stated, turn yourself in to the CPSO. Let the other staff know. Turn yourself in to the police. Go to prison where you belong. You cannot make your paycheck. You harm people illegally and made your $1 million doing it. You have no respect for human life. What you did is morally wrong, is not justified by God in any way. You disrespected Jesus, not to morally do right, but did wrong. The respect of Jesus does exist, is true. You did sin the worst against human life. These are sins against another human when you wrongly did more admitted on forms or harmed another human health or life. When a human, even at least like me, didn't choose to be wronged and harmed and didn't deserve my human dignity, God, as a human, valued as any human, to be disrespected on earth. Rights, freedom of choice. Me as a woman, a human, have a life, emotions. I have no children. I am homeless and I have no money and live in Canada where it's cold. Could have done research, at least I cared, but you damaged my brain and my physical health for many years. And you have to turn yourself in and go to prison. Do the morally right thing. Stop harming other patients if you're doing, especially illegally. Stop putting people on forms so you have a client patient to go see once every few weeks. Thank you everyone for listening. Please do the right thing. Remember, you don't want your health harmed. So please do the right thing so it can care for your health and care for the health of others and lives. Hire and employers, President, Prime Minister, Pope, all world religious leaders, and under them employ is your job to employ proper employees, take the time, screen them, think that they're gonna employ others under them to do morally right, to respect other humans. If they don't give them their job. Money they cannot do under God, cannot be paid for morally doing wrong to potentially harm lives. Doctors, psychiatrists, other medical staff, board members, facilities themselves, the board owners, members, and under them gonna harm someone, then hire the right staff from the highest level, maintain this throughout, do your jobs. It's easy to do, that's what you're paid for. If you can't, let someone else. There's millions of people that neither poor, but rather than choose to do that job and really care, would help all humanity. I'm a human earth angel, Angelica Gicella. Please see my YouTube channel. Excuse me. My YouTube channel is Angelica Gicella, Earth Angel. I have what I live through in life, no human should live through. So I put these videos there made beyond disabled, but to help others so that prevent them from being disabled or wrong like me, especially against freedom of choice. For something proper when I can't sue because no money, but to result proper for this, for others to help me. Be human earth angels, use your virtues. Help me, help others, inform with this information, use it, spread it to the highest level governing bodies, the medical facilities, doctors, psychiatrists, do the right thing, turn them in, do what you can, but be safe about it. Inform the Pope, anyone who can, world religious leaders, Prime Minister, the President. Let them know this message, other video I mentioned. Please give to all the world leaders to the respect of human dignity and state exactly what the paychecks and human job descriptions are for and are under God morally obligated to do. If they don't not gonna respect human dignity and health, then they cannot do their paycheck and have to give their job to someone else that will. Please remember this, everyone judged on earth have to morally do right, respect the lives of themselves and the health of others all times.